nation, under God, indivisible, with liberty and justice for all.
Clerk will read the call.
Dear Supervisor, please be advised the Trempealeau County Board of Supervisors will meet at 10 a.m. on November 12th, 2025 in the county boardroom. All county board members' claims are due in the administration office by noon on November 3rd, 2025, so they can be prepared for audit committee approval. Sincerely, Mary Martin, County Clerk.
Roll call.
Bridget Turner.
Here.
Stacy Klein.
Here.
Richard Seisha.
Here.
Lori Severson.
Here.
Andy Todd.
Here.
Richard Anderson.
Here.
Kevin Adams.
Here.
Dick Miller. Kevin Whalen.
Here.
John Austin.
Here.
Don True.
Here.
Robert Becker.
Here.
Renee Lyon.
Here.
Kellen Nelson.
Here.
David Larson.
Here.
Jeannie Nutter.
Here.
Ron Johnson.
Here.
16 to 1.
One absent. Should explain, he just had surgery, I think, so he,
Oh, that's right.
so I don't think he's able to make it today.
He's gonna try to be electronic.
Yeah, that's right, he's gonna be online.
Richard, or Dick.
Dick.
So anyway, certify the open meeting law requirements have been met with proper posting and notification. We have a 13-item agenda. So I'm gonna make a motion to approve. Motion by Anderson, motion seconded by Turner. All those in favor signify by saying aye. Aye. That's carried.
Aye.
Carried. Okay. Minutes from October 25 meeting. Motion to approve. Motion by Don. Second. Second by Kevin. All those in favor signify by saying aye. Aye.
Aye.
Carried. Appearances. District Attorney update, John Shesha. Oh, that's a different version of John.
New improved.
John's at a conference, so just an update from him. With regards to the vacant ADA position, we have received some applicants, and we will be making a hiring decision once we have interviewed all suitable applicants. With update for where we at with our cases, for 2025, we have opened or filed 848 cases. We have over 100 cases that are still active from previous years, 2024 and before. That means each of our DAs are handling 450, at least 450 cases each. And we have about 308 cases that are in warrant status. And then we have 155 cases that we still are needing review, which kind of proves to the point why we needed the second ADA position. So that's just a brief overview of what John wanted to give you guys an update on.
Okay, any
Okay.
questions?
Any questions? No? All right, thank you.
Thank you. Sheriff's quarterly update.
Good morning.
This is probably your last one, too, I suppose.
This will be the final one, yeah. And I'll try to keep it a little bit short, too. I know you got a long meeting today, so I'm just going to go through the statistics like I normally do.
Okay.
And then if you have any questions at the end, of course, you can ask at that time. So for this quarter, it's August through September. The dispatch center received 2,822 calls for service, sheriff's office only. And those aren't necessarily just calls that come into dispatch, but that's complaints or cases that dispatch create because a deputy needs a number for something. But activity level for the dispatch center is down about 400 from the previous quarter. At that time, it was 3,228 calls. You know, it's a little bit slower time of year when it comes to crashes. I don't know if people are more better behaved or what, but we have been down in our numbers for our traffic deputies as well for much of the year, and those are all calls that are added to that as well. So, as far as crime data goes, not necessarily crime, but death investigations held steady. 29 this quarter, 30 the previous quarter. Most of those are just deaths handled by the coroner, but that come in through our dispatch center. There were 2 that the sheriff's office were involved in investigating, but no foul play in any of those. Drug abuse violations is up in this quarter. 51 new cases were taken out for drug violations. They don't all result in referrals to the district attorney's office, but they do begin new tracking or new drug follow-up cases for drug activity that's going on in our county. So that's up a little bit in this quarter. Again, I'll note, this hopefully will be remedied once we get fully staffed in our traffic division, but I'll note that we still have not had a drug investigator position. I chose that I think I needed to keep the traffic numbers more level, because when we promote that person or when that person's assigned to the drug investigation, it comes off of the traffic position. So it's been a long time since we've had a drug investigator, but I think we're very close to making that happen again. So simple assaults are just what you would commonly refer to as disorderly conducts. 28 this quarter versus 27 last quarter, very typical. Burglaries are down 1, 3 versus 4. Thefts, it seems like we should have a lot more thefts than 4, but the previous quarter we had 6. So we really haven't had a lot of problems with thefts and burglaries in the last few quarters. So no motor vehicles stolen in that time period. As far as crashes go, this one is dramatically applicable to or proportionate to a rut. So we have seen 225 crashes this quarter versus 155 last quarter, and most of those are deer that are called into the dispatch center. 146 car deer crashes versus 90 from the previous quarter, so that's the reason we have the increase. We've had 55 property damage crashes versus 49 in the previous quarter. 24 injury crashes versus 16, and no fatalities for this quarter again. We are sitting at 2 for the year, which is about the average. So yeah, hopefully the next 2 months goes pretty good. For enforcement activity, these numbers are down a little bit, reflecting on the fact that we haven't had a full staff of traffic deputies. 216 traffic citations were issued versus 233 in the previous quarter. 21 non-traffic citations, and those are crimes that the county has adopted into their ordinances for which we can write an ordinance violation instead of a criminal referral, such as trespassing or disorderly conduct or even some theft cases. 21 non-traffic citations were issued versus 24 in the previous quarter. 206 warnings, that's down pretty substantially. Of course, that's the enforcement choice for most deputies is a warning versus a ticket. So previous quarter was 249 warnings. And then OWI arrests are up a little bit, 12 this quarter versus 9 last quarter. And again, these are just county deputy activities. So mental health incidents are down, 7 in this quarter reported versus 13 in the previous quarter. I suspect that Corporation Counsel would see a proportionate reduction in Chapter 51s as a result. That's where they all start, is our mental health calls. A number of them turn into the Chapter 51s. So as far as the jail goes, as of yesterday, we had 57 in custody. 9 were Jackson County inmates. They're down a little bit. The previous quarter on that day it was 14, but it's averaged between 10 and 15, pretty steady, sometimes as high as 20. We do have 14 Buffalo County inmates at this time. The previous quarter we had 1, so we now have all of Buffalo County's inmates in our facility. We don't have any on EM right now. That's all strictly because of qualifications. Most drug violations don't qualify, and that's a high number of our population is drug violations. So. And then as far as staffing goes, we have a jail sergeant open yet, and that is, we just did a hiring process for a jail sergeant, and we had 1 applicant that failed in background investigation. So we're back to ground zero for the jail sergeant. And we have a number of employees in either background or field training for the other vacancies in the jail. So we're actually, we have a number of open positions yet, but we're looking really good at getting those filled here shortly because of those activities. Dispatch, we have one open right now, and but we have one in field training. So we're doing well in dispatch. Patrol, we've hired 4 so far of the 5 vacancies that were this year. We have hired 4. One came off field training earlier this week. Another one is just about done, and 2 others are just going to be starting field training. So we're still working on filling some of those open positions, and we have 1 left to hire. We are going to start a brand new hiring process again because we don't get the number of applicants, so we have to do another hiring. So overall, though, a year ago, it was a lot more dismal picture than it is today here in Trempealeau County. So that's good. I hope that trend continues as well. So just a couple of notables. A big one, we moved into our dispatch center here a few weeks ago, and that completes the project as far as I know. We're still, we got the new bunks on site. They haven't been installed yet, but the dispatch center was the final piece of the puzzle. That crossover happened on one day, and there was a lot of prep by IT, a lot of prep by Jeremy, and a lot of prep by both our medical or our radio provider and our 911 provider. And I'd say all those folks, including my dispatchers, did an outstanding job in making sure that could happen. If you were listening to a scanner that day, I'll bet you would have never even known anything was going on. So if you want to stop in and see it, I invite you to stop down and see what the new dispatch center looks like when it's in operation. I think you'd be impressed with it. So, and the only other thing I'll mention is just something that was in the news yesterday. If you're Facebook followers, we did have a chase here a couple of nights ago over the weekend. And if you read the comments on Facebook, it's everybody, most of them saying, why chase, don't chase, you got the plate number, whatever. But this particular person had made viable threats that he was heading out to kill his wife and her family. And he was intercepted while he was en route to do that. And the chase was on. It ended in a crash, I believe, and he was taken into custody, and a handgun was found in the car. So one of those chases that we have to do, and because the public is at risk regardless, whether or not we chase. So I just thought I'd bring that up. Those are kind of there's probably more I could bring up, but I know you guys have a long meeting, and I didn't have a lot of time to prep. So outside of that, yeah, well, I do care. I'm still here. I'm still in uniform yet. So, but the days are numbered. I probably have about 5 days left in the office, so working days anyway. So, thank you.
Yes, thank you for your service.
Thank you.
I
Yes.
was just gonna ask if this board actually accepted your resignation. No. Which I don't accept it.
I did get a letter from the retirement center saying they're going to pay me my first check, though. So that's all I care about. That is an important one. Yeah, but it's I've mentioned it. If you've listened to the radio show or saw the newspaper, it's been great working with all you folks. I've had a good county board every year. I think Rich can attest. We've had many over the years. So,
We will miss you.
and I'll miss this
I will
place
miss
too.
you.
Yep, I'll miss the work. I'll miss all you guys. I won't be a stranger. I'll stop by and maybe I'll run for county board someday. So,
Right.
Dave's doing a good job, though. I'm not going to run against Dave. So. But no, thank you for everything, and I wish everybody well in the future here. So, thanks.
Well, we thank you immensely.
Okay, thanks. County administrator update. Oh, I missed it?
You have an old one.
Good morning.
Oh, I don't have the new one.
Just a quick update on the overpayments that the municipalities received. We have the Village of Ettrick, who has paid half back and will pay the second half in December. And the Town of Dodge, which already paid the first half and will pay the second half in December. And the Town of Sumner met last night, so I do not know what their outcome is, but they did plan on mailing the check back.
Okay, any questions of the treasurer?
Other than that, the county's been made whole.
Yes.
Okay, thank you. Now the county administrator.
John, I had,
Oh, did you?
Michelle, I'm sorry, I had one question for
sorry.
you. I know in your letter to the exec finance committee, you talked about switching over with the software programs and how those tax papers were gonna look a little different with the communities. Have you set anything up as far as education or to preempt those questions that those communities are gonna have, or some sort of a document, any educational things that you?
None of us
that you're
have
working
had
with?
training on it actually yet. It's just we submit a ticket and then whoever their tech support is responds back to us. And usually it's a handout that explains how to do it. So far, we haven't had any in-person training for the tax bills. Karen will be down here and in my office to be working with me when I'm generating the tax bills.
Okay.
Any other questions?
Was there clarification on what exactly caused the incorrect payments to be done?
Just, but I don't know, something, you want to explain it? What the problem was that caused the overpayment?
They got doubled is what happened, bottom line. And some numbers got entered double on the lines, so it was an overpayment.
How was it caught?
One of my municipalities pointed it out to me, so then I went and looked into it, and we got it resolved.
Okay.
Do we have some sort of plan in place just to make sure that we're covered on that in the future? Is somebody double checking that?
Well, our new program is not supposed to allow that to happen. It won't save it, it won't continue on to the next, so I'm hoping what they say is true.
In my opinion, even though the new system's not supposed to do that, that's what it's not supposed to do and what it does. I think it's still good, at least at this time, until we know for sure that new programming. Because at my civilian job, I work with a lot of programming. I think it's better to just have someone overlook it until you know for sure.
Yes, I'm working with a couple counties up north who have the same program, and they've had it over 8 years.
All right,
So they are like my mentor right now.
okay.
May I ask a question, Mr. Chair?
Go ahead.
Just following up on Supervisor Turner's question about the training, you said that, am I to understand that if municipalities or you have questions, you submit a ticket to whom?
To T-Tech support.
That is like a statewide? Or for, not statewide, but for this program?
Correct, yeah.
Is that something that maybe you could delve into proactively to get a curriculum, ahead of time, being the county treasurer, that you could get something and dispense it to the municipalities ahead of time?
They have the same access that we do. Am I right, Nick? Nick knows better about it. He got it all set up.
So at the end of October, we had all the municipalities come in with T-Tech representatives here, and they gave an overview tutorial and set them up in a staging environment where they can go in and practice receiving tax bills and get familiar with the program in that staging environment. That staging environment's gonna be up through the end of this year. So we just encourage municipalities to go in there and practice entering in the information on how to receive a tax bill. They have a great support system as far as a separate website they can go on. They can type in a question, documentation comes up. It'll either be a written document or they have videos that they have made up that will step people through the process for whatever question they have.
You say they have a written document.
Correct. It's all there.
Well, I'm wondering if that written document could be made available
It's
ahead of time.
all the municipalities, I have them all set up in this environment.
Okay.
They have full access to everything through
Okay,
support right now.
great, thank you.
So what you're saying is actually the municipalities have had a lot of training and they have they have it at their own discretion
So-
to work on it and practice whenever they
Yes.
can.
On October 28th, we did meet here
Right.
with all the municipalities.
So you did good. Thank
Yeah,
you.
we did everything that was requested.
Thanks.
I can testify to that too. My wife's the treasurer and she's on it every day, just working it out, make sure it works, so.
I'm a town treasurer, so I have to learn it also.
Good to know. Thank you very much.
Okay, thank you. Administrator update.
So I've sent you an update through email. Just wanted to point out and remind you that tomorrow at noon, Senator Stoffsholt will be here. It's not a paid compensation to attend, but everybody is welcome to attend. Department heads will be meeting with him and sharing the same presentation that we did with our other representatives, with a little bit more information now that the biennial budget is in at the state. We'll share some of that information. Otherwise, if you have questions about my update, feel free to contact me. I'm going to ask Shelley Reitman to come up, and she's going to just cover a little bit more information about the transition that we've had with the voluntary insurance benefits and our progress on that.
So we successfully have all benefit eligible employees enrolled in their 2026 benefits. That concluded on October 31st. That was the end of our open enrollment window. So as you know, this year we did it a little bit differently for open enrollment, and that is because in 2026 we are transitioning to a different benefit model. So this year, what happened is we partnered with Clarity Enrollment Benefit Counselors, and the Insurance Center, who we've worked with for, I think, 20 plus years, is how we got connected with this company called Clarity. So Clarity and Trustmark are these new benefit providers that we work with. They are part of the Insurance Center. The Insurance Center is now under what's called the Alera Group, and so the Insurance Center now has access to more benefit vendors. So that's why we were able to connect with Clarity and Trustmark. And so those benefit counselors came on site and they conducted one-on-one benefit meetings with each employee and got them enrolled in our newly offered Trustmark benefits, which are available now in 2026. Not only did they do that, they also helped employees in the new UKG system by sitting with them and guiding them on how to do their benefit elections for their health, their dental, their vision, and their flexible spending account. Those are not benefits that Trustmark or Clarity have any involvement in administering or managing, but that's part of their service that they offer. And we educated them about those plans so that they could sit with employees and do the whole package of benefit enrollment. And employees had never gone into UKG before to do benefit enrollment through the open enrollment platform. So that was their first experience with that. And they had that one-on-one counselor to walk them through that. I would say overall, it was really great working with the Clarity Benefit Enrollment Counselors. I was there for every event. We hosted several all-day-long events to make sure employees, scheduling wise, could make it. And it went really well in that regard. Some of the things that came up during open enrollment, there was some feedback from employees with concerns about the Trustmark benefits themselves. One of the major concerns was that Trustmark was only offering what we call a permanent life insurance option. Currently now in 2025, what employees are able to have as far as life insurance goes is they are able to get a term life insurance policy and a whole life insurance policy. That's the existing right now. So yes, in 2026, that did change in the sense that Trustmark doesn't offer what's called a term life policy. That's a very affordable life insurance policy. It does increase over time as your age increases, and people tend to outlive those policies. So you might start out with $150,000 in coverage, but by the time you hit 65 or 70, that can come down to $20,000, just generally for example. So employees found that the permanent life insurance was more expensive, which it is,
but it is a more robust type of life insurance policy than a term life, which is simply a death benefit payout. So we got together and pivoted very quickly to come up with an option for employees to be able to have a term life policy. Being Trustmark did not offer it. So we partnered with the Insurance Center again, and employees are able to go to the Insurance Center, get an individual quote for a term life policy directly with the Insurance Center. We've already seen some quotes come in. I asked for a quote and reasonable. Mine was reasonable. Now, I certainly can't speak to every employee because it depends on age, tobacco, non-tobacco use, but I did get a quote from, I think it was 4 different life insurance companies the Insurance Center provided me with, and 10-year, 20-year, 30-year term plan as far as a cost, and I did find it reasonably comparable. Yes.
Yes, did they, when they changed, did their what they had to pay go up quite a bit compared to what they were paying, because those policies before were all set up way back, and so everybody took an increase here. They took a hit on this, correct?
Well, so not exactly. So employees that are currently enrolled in their All-State accident, cancer, critical illness, and All-State whole life insurance policies are able to continue those policies as they are for the same exact premium they have been paying. So in that sense, no. Employees would not be increasing the amount of money they're paying for those benefits because they can continue those. We won't be doing the payroll deduction, so they will have to pay Allstate directly for those benefits. Now, the ones that they couldn't continue over would be short-term disability and term life insurance. Now, Trustmark does offer a short-term disability policy, so employees did have that option to get into a new short-term disability. Term life insurance, yes, that one, they will probably see some type of cost increase simply because our current life insurance, term life, through the standard is a group rate. So you can only get a group rate as an employer by doing a payroll deduction, primarily. It is very difficult to find an insurance agency that is willing to just have the employees pay them directly and still give you a group rate for a term life insurance policy. The Insurance Center searched far and wide to try and find something like that for us, but it doesn't exist because insurance carriers want, you know, the numbers of people coming in. And a guarantee of that is an employer doing, you know, a payroll deduction for that benefit, or it helps to certainly guarantee that their enrollment numbers are going to be large to give you such a low price on a term life insurance.
Like we used to have for 20, 30 years.
Yeah.
But the switch is not good then.
Well,
Why would you change
it's a
it?
change, so
The industry
Trustmark
changes.
is only offering a permanent life insurance policy. People can continue their whole life insurance policies that they have currently through Allstate. They can continue that and there's no change. It's just now if you want a term life insurance policy, you would have to seek out your own broker, which you could certainly do, your own insurance agent, or partner with the Insurance Center and they can give you an individual quote. It's certainly probably going to be more expensive, but just using my example of my own quotes, I found it to be very reasonable and more perks to the policies that they're offering me than what I would have even had with my existing term life insurance. So yes, there is a little bit more of a cost, but to me, it's not unreasonable, but that's my personal quote that I got.
Question for you, Shelley. At a previous meeting, we stated that we were going to send out an email informing everybody of the availability of the term insurance still. Did that email get sent to all
Yes,
employees?
absolutely.
Or was
It's
it
been
just
sent
sent to the ones that had term insurance
Oh,
before?
no. Nope, it was an all-staff email.
It was an all-staff.
Yep,
Okay,
I'm the
'cause-
one that prepared that email and sent it out. Yep.
Would that have been the end of October or beginning of November?
It was
I
during.
just had calls on it, so I'm
It
double
was
checking.
during open enrollment. I'd have to reference the date of that all stuff email, but I have sent it out even a couple more times now, just
Okay.
reminding
It
employees.
could have got missed by somebody who doesn't check their emails
It's
religiously.
very possible.
All right.
And there was a flyer that the insurance center created for us as well that I attached to that email that went out to the employees. And it had contact information of all the insurance agents from the insurance center, their email, their phone number.
So it would have been from the insurance center.
The flyer itself was made by the insurance center, but the email came directly
from
from
you.
me.
Okay.
Yes.
Thank
I
you.
sent
That's
it
what
out.
I
Yep,
was
I
inquiring.
sent it out the same way in an all staff email that I did with all of the other open enrollment materials.
Thank you.
Yes.
So may I speak?
Go ahead.
Okay. So I just want to, I think what I'm understanding you to say is that initially when we made the change, the biggest difference was that the company that we went with did not offer term insurance, term life insurance.
That's right.
But since then, a lot of work was done to be able to offer that, although they are going to have to find their own broker or go, it's not a group plan, it is the difference. But they are able to get it at a reasonable cost now, but that was not initially the case, correct?
Yes, correct. Initially, Trustmark only offered permanent life insurance, not term. During open enrollment, just a lot of feedback that employees really did want an affordable term life insurance policy, just like they had now. So yes, the insurance center has made themselves available to offer those policies out to
And
employees.
is that across all enterprises?
Yes.
The healthcare center, the
Yes.
highway, all of that? Okay. Thank
Yes,
you.
in fact, I had already started reaching out to the insurance center with the feedback I was getting being at the open enrollment meetings. And at the same time, Jerry was getting the same feedback. See, I had like 3 meetings before him, and then the counselors transitioned over there. So then Jerry reached out to me and said, "Are you getting this same feedback?" And I said, "You bet I am." So then Jerry actually organized the meeting so that Janice could come on with us and we could talk through this, like what are our options? And Janice is our broker from the insurance center, and she's been working with us all along. So we were able to, in that meeting, Janice was like, "Yep, give me like an hour or two. I'm going to prepare a flyer. I'm going to get my team ready, and we're going to have a term life insurance option available that you can communicate this out to your employees." So yes, we were able to get that out pretty quickly with the feedback we were having. Yep. Yep.
Go ahead, Ms. Snyder.
I just have a quick question. Because there was so much confusion about the term life insurance issue, did all of that have to be dealt with during open enrollment, or is it still possible for employees to continue to pursue the term life insurance stuff? It didn't have to be done during open enrollment.
Right, yes. So with the term life insurance, if employees want to pursue that with the insurance center, they can actually do that at any time. It is
Okay.
not tied to an open enrollment
thank
event
you.
whatsoever. So yes.
Okay, thanks.
Yep.
Thank you for
Go ahead, Ms.
sorting
Klein.
through all of this, Shelley. I really appreciate it.
Yep, absolutely.
My question, so
Yeah.
I just want to make sure I'm understanding correctly. So anybody who had a term life policy, they have to cancel it?
Yes,
at the
it
end
will
of the
be
year?
canceled as
So-
of December 31st.
This is where I'm having a very difficult time with this decision.
Yep.
Because you have a number of people who thought they had coverage locked in for a set amount of time, and it wasn't a decision that they made, but now because of age, medical history, any of the factors, they might not qualify for insurance. They might be rated and be much higher, and then their only other option really is to go into the permanent insurance, which again costs much more. So I think it's leaving a lot of our more tenured employees in a really difficult situation. And I'm not sure if there's other options where we can cover them somehow, but this whole situation just makes me very livid.
I will say that when Jerry and I did have that meeting together with Janice, we did ask her to look into, could we get back into the standard plan? But she said, well, you do know you'd have to do the payroll deduction. There's no way I can get you an agency that's going to, give you a group rate without you have to do the payroll deduction. And so at that time, Jerry, well, let's just explore it. Just see what they're willing to do. She did reach out to the standard And they actually weren't even willing to get us back into the plan because of our claim history as well. So we did ask for that, not that, I just wanted all options to be on the table. And that wasn't even something that they were willing to do. So it could be certainly a different insurance agency one could go with. I mean, you know, the Insurance Center has access to a lot of different life insurance. You know, we were with Principal before we were with the Standard, and we actually just recently switched from Principal to the Standard. So we haven't even been with the Standard very long, I think 2 years, as far as term life coverage goes. But we've had different vendors over the years that the Insurance Center has given us. So.
Mr. Todd.
I got 2 questions for you. First question is cancer insurance.
Yep.
So us switching over, you're telling me is, say somebody had this cancer insurance, didn't have cancer, had cancer insurance. Now they have cancer. As of January 1st, they still have that coverage? Or do they have to go back out and get cancer insurance again? Or are they they have it, that's not going to cancel, they pay the same premium, everything's okay?
Yes, and all employees that were enrolled in the all-state cancer, critical illness, and accident plans are able to continue that same coverage at the same premium cost. The only difference is they're paying Allstate directly instead of us doing the payroll deduction.
And is that through the same group rate?
Same rate. Premiums don't change.
Okay.
Yep.
Another thing is, why did we stop taking the money out of the checks?
Yeah, yep, so that was due to, the primary driver would be reducing administrative workload for human resources. As to why? To vision to go into more of a self-service model for the employees due to the administrative load that administering these benefits have. It does take an entire full-time person to administer these benefits, include payroll deductions play a big role in that. It's not as simple as someone signs up for a benefit premium and I just communicate to Stacy in payroll what that premium is, and then it's happy days, ongoing. There's a lot, I have to reconcile that, pay the bill on that each month. There are changes when anyone has an age change, if age is connected to benefits, and some of them are, and wage change as well. So some of these benefits depend on your age and your wage. So that has to be changed in the system as well. And then there's reconciling of, did they overpay premiums? Did they underpay? And it's a lot of manual work to administer these benefits. Then you have life change events, where people get married and they have children, and then you're changing premiums, and then they go on FMLA, for example, on a leave. And then they don't have enough leave time to pay their benefit premium, so we're trying to back collect on benefits and reconcile all of this. If a person's out on short-term disability leave, they're going to get their premium reimbursed. These are just a couple examples of all the administrative tasks involved. And that's not even including year-end reconciliation of these benefits.
So we're not doing that now with our regular benefits. It's just we enter it once and we're good on our regular, but that we're actually still carrying.
I'm still doing that for all of our benefits right now through December 31st.
So after December 31st, once it's set, you don't have to worry about marriage, you don't have to worry about kids, you don't have to worry about nothing. It's automatic, or they do it?
Only for the Trustmark benefits, because it's only the Trustmark benefits that employees are paying directly to Trustmark for, or if they chose to continue their existing plans through Allstate, then they're paying Allstate directly. Now, I still have the same type of benefit administration for the health, the dental, the vision, and the flexible spending, because those are ETF benefits, employee trust funds, and then the flexible spending is through EBC, Employee Benefits Corporation. I still have weekly billing on the flexible spending that's done, and still the monthly billing and the payroll deductions for the health, dental, vision, and flexible spending. Those are still pre-tax payroll deductions like they always have been. It's just these other voluntary benefits that we're not doing the payroll deductions for, which is like the accident, the cancer, the critical illness, the life insurances, and the short-term disability. Those are the plans that are no longer payroll deducted and tend to have the most administrative burden.
So if you were to take a guess, 1 hour a week, 10 hours a week, what's this going to save you for not doing that? If you were to take a wild guess. I mean, how much time are you really putting in on this?
Oh, a lot. It takes a
Okay.
full-time person to do it. And it's, I have other tasks too besides this. I couldn't tell you because now we're in the middle of switching to UKG, which is going to change the whole process as well. So I can track that and let you know if it really does save me time.
Yeah, that'd be good.
I can certainly do that.
I appreciate that.
Yep.
Go ahead, Ms. Stark.
So just to be clear,
Yeah.
if you have all of the benefits through Allstate and you can still keep that, you can just say to Allstate, well, I mean, I have, Thrivent takes my life insurance right out of my checking account.
Yep.
So you can do, an employee can do the same thing. You can just say to Allstate, here's my check, just take it out of my checking account.
Yep, that is what that is what happened. And at open enrollment, employees actually set that up.
Okay.
With
So
the,
it's already set up.
Yeah, it's
Employees
already
have
set
already
up.
set that up
Yep,
with
they've
your
already
assistance.
they've already set that up
Okay.
with the Clarity Benefit Enrollment Counselors. The only thing the employee has to actually go out and do on their own would be if they want to continue those Allstate plans, because those are not Trustmark's benefits.
So those benefits didn't change, the price didn't change, it's just, I now have to tell Allstate, however you do, all my bills are just taken right out, otherwise
Correct.
I would forget to pay them.
Yes, the employees were given information.
It's the term stuff that really has people in a tizzy, not the whole life in the Allstate.
Right, because
Okay.
they could continue those benefits at the same premium.
Right.
They do just have to make that
just have
contact
to
with
find-
Allstate and set up the payment method that they're doing
Okay.
and pay directly to
Does Allstate
Allstate.
have they don't have a term option?
No,
Right, okay.
no, Allstate was our whole life insurance
Okay.
provider.
Thank God you're doing this and not me.
That was a lot of that was pre-tax before, correct?
It was,
It was a
yep,
nice perk for the employees to have a pre-tax. It's not a huge amount of money, but it is.
it
amount of money
is. It is.
for
The whole
everybody.
life insurance was not pre-tax. That was post-tax. But yes, the short-term disability, pre-tax. The accident, the cancer, the critical illness, that was all pre-tax. The term life insurance, only a portion of that was pre-tax. So the first $50,000 of the employee-only term life insurance is pre-tax, the rest is post. So if you had a spouse, you had children, that's all post-tax. Only the first $50,000 of your own employee policy was pre-tax. Yep.
Okay. Any other questions? No, we'll move on.
Oh, one thing I did want to mention is, at the next PB meeting, Janice, our broker from the Insurance Center, is going to be coming to that, and she is going to do a side-by-side comparison. We asked her to do this, of the plans. So the plans that employees have now in 2025, compare those side-by-side to the ones that Trustmark is offering, so that it can clearly be seen what the differences are between the plans. And then she'll be able to go to more in-depth if there are questions about term life, whole life, permanent life insurance, and that change, and how the employees, are affected in that way, and go into more depth, because she is a licensed insurance agent. So she will be coming to do that.
When is that meeting?
Anyone know when the next PB is?
20th.
Yeah,
Was-
the very
was-
next PB.
20th at 10?
Can you address there was an individual that has cancer insurance, and then the family member that couldn't get the cancer insurance?
Yeah, that situation I wasn't involved in directly, so I'm sort of going off skimming an email.
Yeah, I can speak about it otherwise, so.
yeah.
And I'm hearing it secondhand as well, but I did follow up with Janice. There's an individual that has cancer and cancer insurance, and her husband got cancer and then was not able, now again, she can keep the same plan that she's had. The issue is if an individual's not already listed and the husband was not listed on the plan, so now he gets cancer, he's not going to be able to get cancer insurance from anybody. So he was not on the plan, so there was no way he was going to get covered, even with
Right.
the Allstate.
Okay, yep, that, I remember that issue. Yes, that is true. That was initially brought to our attention, thinking that was something that was happening to this employee as a result of this change over to Trustmark benefits, or during this open enrollment process, this person wasn't being allowed to make a change to the cancer plan, but their spouse did in fact currently have cancer that is a pre-existing condition. So even if you make a change during open enrollment and say, I want to now add my spouse onto the cancer plan, if they already have existing cancer, the date that their benefit coverage starts, that is still a pre-existing condition for all cancer plans alike. And that person wouldn't be covered under that current situation of cancer.
But the pre-existing condition does not have anything to do with your health insurance.
No.
Right, this is all, so if you have cancer and you have health insurance, you're covered.
You are covered.
Right, so let's not get that all confused if people are listening.
Correct. Yes, this would just be an
This is just
extra
life
cancer
insurance,
insurance.
right.
That example was an extra insurance to cover if you are diagnosed with cancer, you would get a certain payout of money from Allstate for your treatments and certain things that you have done as a result of the cancer. There's a certain designated amount of payouts Allstate gives you.
Supervisor Anderson.
Mr. Chair, I'd like the members from the Healthcare Center are here. I'd like to hear what they have to say, if that's okay.
It's fine with me.
They were involved in this, I think.
Well, yeah,
so-
they're involved with this. They have the same insurance, I understand, right?
Yes, we have the same benefits. This move to Trustmark, the healthcare center also made that same move. It had to be uniform as a whole. When we switch benefits, carriers want to see us as a whole of Trempealeau County moving to that, and they're not usually willing to just let courthouse and highway do certain plans if healthcare center employees aren't involved to get the numbers, and we are considered one employer from how they look at us. So yes.
Did you have some comments you wanted to make, Jerry?
Sure, Joe, I was, Shelley, you do a nice job, by the way.
Thank you, Jerry.
Jerry Dietz, Joe Minch, the other administrator. Just a couple comments that, and Joe's been really spearheading a lot of the, with the insurance group with us and so forth. One thing that's important for this board, one thing that's important for this board to understand is that the approach with all of this has been challenging for all the county employees. When we have a portion of the 270 employees of the whole county, a lot of frustrated employees. We tried our best to educate them the why this all happened, the alternatives that they have and so forth. 80%, over 80% of the employees did have the term life insurance, which is very detrimental for many of them. Many of us made the request through the insurance center, which we just now are recently receiving some term life quotes. So that delay was very, very frustrating. We had weekly conversations. Shelley has been, very willing to partner with us. And we're now just getting those through. Some of the comparables for the life insurance are affordable, but many of them are not for many individuals, as Supervisor Klein identified that as some of us age, that that benefit goes down, your premiums go up, and so forth. With that being said, they're not all affordable, so there are options that are provided. The delay was very frustrating to the employees. We did reach out, as Shelley stated, that we did try to look at a group plan under the contractual things through the insurance center. There was some criteria that didn't also permit us to do that. And so again, we remain positive and try to go down the right road to provide services. Trustmark, in my opinion, or Trustmark doesn't offer the cancer insurance, so there's some benefits out there that are not offered compared to what we did have. So again, we're trying to work really hard. We're challenging the insurance center to work with us as a whole for the county to see what we can do. It's a lot of frustrated employees, and we're trying to temper that and educate as much as we can. I know Joe had some comments here.
Yeah, the big thing for us is we found out so late in the game, so we had no information about all this, and I reached out to Janice from the insurance center right away, and I'm like, can we set up a call to get a comparison of what we have versus what we're getting? And due to the time, open enrollment was already happening, so she said we'd have to wait till after open enrollment, which we're starting to do now, as Shelley mentioned. So we'll finally get a comparison of what we had versus what we're getting. But employees were frustrated because they went into those meetings not knowing any of the differences. And that's when they found out the difference between term and the permanent plan, and that there was no term life being offered at all. So like Shelley said, Jerry and I and her reached out to the insurance center and said, hey, we have to do something for our employees here. And that's when this has been offered and the flyers were sent out. And people from our place just got their first quotes, I think Monday. So it's taken a couple weeks, but some of them are coming back pretty good. And I think the people that we're worried about are the people with the pre-existing and the issues that they might have a hard time because they're not guaranteed coverage under that business-sponsored plan anymore. So that could be a big factor going forward. We don't know yet, so.
And that's something that, I'm very glad, and thank you, Shelley, that we're going to, I wish we would have gotten these comparisons prior. I'm a visual person where I like to see what we currently have here and what this is, what don't they offer. There was a lot of things that we were also told that everything would transfer, and it didn't. I had multiple general staff meetings. Even on the night shift, I came in and met with all the employees, and again, educating them that we will work through this together. So that's the only comments I had to make. Any other questions from us?
See no questions, so thank you very much.
Thank you.
I think that concludes that part. We'll go to item 6A. It's a resolution to reimburse Trempealeau County Libraries at 100%, which I understand is already in your budget, right?
That's correct.
Okay.
Whereas Trempealeau County has 9 in-county libraries located in the cities of Arcadia, Blair, Galesville, Independence, Osseo, and Whitehall, and the villages of Ettrick, Strum, and Trempealeau. And whereas several years ago, the state of Wisconsin passed legislation for counties to financially support local libraries for circulation for non-resident borrowers, which include our local in-county libraries and adjacent out-of-county libraries. And whereas the county is mandated to reimburse those libraries at a 70% reimbursement rate for Trempealeau County residents that are considered non-resident borrowers. And whereas the levy required for libraries is only calculated on non-resident usage. And whereas the levy for libraries falls outside of the levy limit requirements, so does not affect county funding for operations. And whereas the Library Board of Trustees from the City of Arcadia and the librarians from the City of Blair, Sarah Waldera, City of Galesville, Laura Onis, City of Independence, Kayla Matson, City of Osseo, Gina Waters, City of Whitehall, Amanda Heggie, and villages of Ettrick, Carla Dunham, Village of Strum, Dawn Herring, and Village of Trempealeau, Megan Opelt, have requested support at a higher reimbursement level for their libraries. And whereas the Executive and Finance Committee has reviewed the request and recommends supporting the 9 libraries at 100% reimbursement level for 2026. Now therefore be it resolved that the Trempealeau County Board of Supervisors approve supporting the cities of Arcadia, Blair, Galesville, Independence, Osseo, Whitehall, and the villages of Ettrick, Strum, and Trempealeau at 100% reimbursement rate for non-resident circulation in 2026. Introduced by Executive Finance Committee Dave Larson, John Austin, Bridget Turner, Robert Becker, Richard Seisha.
Move to approve.
Second.
Motion by Supervisor Nutter, second by Supervisor Turner. She was first. Okay, any discussion on it? Hearing none.
Chair?
Yes.
I'd just like to make a comment on it when it comes to libraries. Again, I'm not against libraries. I'm going to start out with that. But I am against the idea of libraries spending the money and the next year that we approve that money that they spent the year before. So to me, if I was in a business, I'd be looking at like, all right, I'm going to spend some darn money because I know somebody else is going to approve that money later after I spend it. So I'm against the process of how that works. So that's why I want to speak up to that. I know there's a lot of people that won't speak up to that, but that's kind of where I stand when it comes to having an open book.
I see Amanda's here. Would you like to explain how, this isn't covering everybody in
Statutory.
town? This is for people who are out in the country coming. Okay.
Yes, I just, so I'll try to clarify as best I can. I'm not an attorney. So this is laid out by state statute. So you are paying a bill for service already provided. You're not laying out funding. Library boards are, all of the services that we provide are overseen by each individual library board throughout each municipality. Each expenditure is, I would say, heavily scrutinized. And we try to wring out every penny that we can out of the money that, the expenditures that we make. I encourage everybody to participate in their library board meetings. You're welcome. You're all members and you're all welcome to each committee. And if you are worried about the expenditures that your library is making, you are welcome to come to a library board meeting.
Okay, go ahead.
I just have two comments. One, I don't think the libraries ever sit around and say, we're gonna get this money, so let's spend it on things, because my library collected cans to pay off their mortgage, and it took like 10 years, 20 years. So the libraries are not spending money irresponsibly. And that pissed me off so much, I forgot what my second comment was. I'm
Could I just
sorry.
add one thing? So the other thing that I just wanted to clarify is that this reimbursement, the beauty of it is that any person who lives in a municipality without a library can use a library in the state of Wisconsin. So that's wonderful. A few years ago, we had a supervisor who's no longer here ask me where would it end? And it would end when you had a library in every single municipality. That's wonderful. That would be wonderful. You wouldn't be paying a non-resident reimbursement. And people are coming to our libraries from places without libraries. They're voting with their feet, and that is where the reimbursement comes from. I feel like there's a misunderstanding here about, like there's a way that we can, that libraries are, and I don't mean ill intent on your part, but I do sometimes feel like perhaps you are assuming ill intent on our part, whereas we are just submitting a bill to be paid. No? Okay, I hope not. Good. Let's chat sometime. I would love it.
I just remembered what I was gonna say. We do have a representative from this county board that's on the Winding Rivers Library group. And we never get,
He's planning on coming.
who is it? Is somebody from this county board that's, Lori Severson, I believe, was.
Yes, it is me, yeah.
Appointed. And I have asked John a few times to have you speak on what happens at those, their quarterly meetings or
I
twice a
believe
year?
so.
Quarterly?
I believe they're quarterly.
Okay.
Yeah.
We're gonna have
Because then
to
that
end-
would help inform, but we
We're gonna
are
have to
like
end
at
this.
11 o'clock.
We're gonna have to end this with a vote because it's
Yeah,
time to
it's
read.
11 o'clock.
All right, so I'm gonna just call for the
It's roll call, isn't it?
roll call vote.
Richard Anderson. Kevin Adams.
Yes.
Dick Miller.
Yes.
Kevin Whalen.
Yes.
John Austin.
Yes.
Dawn True.
Yes.
Robert Becker.
Yes.
Renee Lyon. Kellen Nelson.
Yes.
David Larson.
Yes.
Jeannie Nutter.
Yes.
Ron Johnson.
Yes.
Bridget Turner.
Yes.
Stacy Klein.
Yes.
Richard Seisha.
Yes.
Lori Severson.
Yes.
Andy Todd.
No.
16 to 1.
61, it passes. This time I'm gonna give you a job, Mary. You can do the first reading of the budget.
Do you have some water?
So there's discussion on reading every line of the budget or just the each account total? What's your preference?
I suggested every line so the public actually sees it.
That's
It
what
should
Paul
be on,
used to
it
do.
should be on the board. And it'll go faster because you're not reading the levy for each line. Like Paul did at times, read the levy for each line, and that takes twice as long, so.
Okay. Well, this is going to be a process. I apologize. All right. The 2026 budget, recommended budget. County Board. Wages and salary, $7,800 for expenses. Per diem, $100. Per diem, $27,800. $50 per diem, $27,800. Social Security share, $3,930.80. Retirement share, $57.60. Medicare share, $919.30. Health insurance, $100.85. Telephone, $348. Office supplies, $1,600. Postage, $200. Publications, legal notices, $3,500. Membership dues, $10,000. Registration fees, $2,500. Mileage and travel, $27,000. For a total expenditure of $113,556.55. No revenue, so levy is the same. Under 800, the phone 800 number consultant, $125 expenditure, no revenue, levy's the same. Under circuit court, wages, $536,815.35. Social Security share, $33,181.29. Retirement, $38,533.11. Medicare, $7,760.14. Health insurance, $130,316.72. Family Court Commissioner, $60,000. Court Commissioner, $3,000. Mediation, $7,000. Interpreter fees, $50,000. Transcripts, $1,000. Jury expense, $25,000. Witness fees, $500. Court ordered doctor services, $75,000. Legal fees, $3,000. Court appointed attorneys criminal, $60,000. Telephone, $2,700. Repair and maintenance, $1,000. GAL fees, Watts, Chapter 880, $30,000. Attorney fees, counsel for 12 and over, $30,000. Office supplies, $10,000. Postage, $15,000. Printer and toner, $4,000. Small items of equipment, $1,000. Membership dues, $400. Registration fees, $500. Meal reimbursement, $500. Lodging, $1,500. Mileage, $1,900. Recognition, $250. Non-lapsing fund expense, $50,000. For total expenses of $1,179,856.61. On the revenue, state court grant, $52,275. County ordinance forfeitures, $50,000. County share, state fines and forfeitures, $60,000. Family counseling fees, $6,000. State reimbursement of GAL fees, $33,000. County share court fees, $100,000. Custody study revenue, $1,000. Clerk application fees, $500. Postage revenue, $3,500. Interpreter reimbursement, $14,000. GAL repayment, $30,000. Attorney fee reimbursement for criminal, $38,000. Probate fees, $16,000. Family court commissioner, $5,535. Child support indirect reimbursement, $25,000. Court-appointed doctor fee, GN cases, $10,000. Attorney fee, JV reimbursement, $2,000. Interest on judgments, $45,000. Fund balance applied, $50,000. For a grand total of revenues, $541,810, which means a levy of $638,046.61. For the law library, other office supplies is $9,605.40. And the LexisNexis revenue of $5,488.80, so a total levy of $4,116.60. Under coroner, wages is $37,000. Per diem at 100 is $1,100. Social Security share, $2,294. Retirement share, $963.74. Medicare share, $536.50. Professional services, $12,000. Telephone, $1,500. Repair and maintenance, $300. Medical exams, $41,000. Miscellaneous lab work, $700. Office supplies, $600. Postage, $100. Continuing education, $1,000. Registration fees, $350. Meal reimbursement, $500. Lodging, $1,100. Mileage and travel, $3,000. Medical supplies, $2,500. Vehicle expense, $3,000. Fuel, $3,000. For grand total expenses for coroner, $112,000, $112,544.24. Under the revenue, coroner fees, cremation permits, $17,000 for a total levy of $95,544.24. District attorney wages, $302,307.21. Social Security, $18,743.05. Retirement, $21,766.12. Medicare, $4,383.45. Health insurance, $112,991.04. Interpreter, $500. Trial expense, $5,000. Telephone, $4,600. Repair and maintenance, $1,750. Office supplies, $3,000. Postage, $1,500. Publications, legal notices, $100. Membership dues, $225. Registration fees, $2,000. Meal reimbursement, $1,200. Lodging, $2,500. Mileage and travel, $2,500. For a total expense of $485,065.87. Under revenue, diversion program fees, $9,000. Copy reimbursement, $8,000. Restitution surcharge, $5,000. July through December 2024 reimbursement at 41%, $41,165.61. Total revenue, $63,165.61 for a total levy of $421,900.26. Under the TAD grant diversions, professional services is $50,000. Telephone is $200. Office supplies, $3,000. Postage, $1,350. Registration fees, $2,350. Meal reimbursement, $600. Lodging, $1,500. Mileage, $1,000. Total expenses, $60,000. For TAD grant revenue, $60,000. Levy is $0. Corporation council, wages, $187,352.88. Social Security, $11,615.88. Retirement, $13,489.41. Medicare, $2,716.62. Health insurance, $28,233.84. Professional services, $60,000. Telephone, $830. Office supplies, $1,625. Postage is $400. Printing, $200. Small items of equipment, $250. Publications, legal notices, $100. Continuing education, $900. Membership dues, $800. Meal reimbursement, $100. Lodging, $700. Mileage and travel, $800. Grand total of expenses, $310,113.63. For revenues, Corporation Council is $20,000. Human Services is $1,000 for total of revenues, $21,000 for a total of levy, $289,113.63. Under special accounting, professional services, $134,510.25. No revenue, levy the same. Indirect cost study, $4,800. No revenue, levies the same. For county clerk, wages is $191,869.89. Social Security share, $11,895.93. Retirement, $13,814.63. Medicare, $2,782.11. Health insurance, $67,977.84. Telephone, $1,000. Office supplies, $1,000. Postage, $400. Publications, legal notices, $775. Membership dues, $325. Mileage and travel, $1,510, for total expenses, $293,350.40. For revenue, county clerk fees, $4,000. And assignment fees, $300. Total revenue, $4,300. Levy is $289,050.40. Administration, wages and salaries, $507,852.80. Finance director with benefits, $140,000. Social Security share, $31,486.87. Retirement, $36,565.40. Medicare, $7,363.87. Health insurance, $135,240. Legal labor relations, $5,000. Professional services, $40,500. Telephone, $1,400. Repair and maintenance, $500. Personal recruitment, $12,000. Office supplies, $1,000. Postage, $150. Publications, legal notices, $500. Continuing education, $3,000. Membership dues, $500. Registration fees, $2,000. Advertising, $250. Meal reimbursement, $400. Lodging, $2,000. Mileage and travel, $2,500. Fuel, $400. Recognition, $10,000. Grand total expenses, $940,608.94. For revenue, we have EPCRA Emergency Management Grant. Oh, those are zeros. So total levy is $940,608.94. The EAP program expense, $9,690. No revenue, levy the same. Under emergency management, wages and salary, $75,649.60. Social Security, $4,690.28. Retirement, $5,446.77. Medicare, $1,096.92. Telephone, $680. Repair and maintenance, $550. Office supplies, $300. Printing, $150. Publication legal notices, $60. Continuing education, $100. Membership dues, $25. Registration fees, $500. Meal reimbursement, $300. Lodging, $500. Mileage and travel, $1,500. Other operating supplies, $3,000. EOC supplies, $1,100. Grant expense, $1,500. Total expenses, $97,148.57. For revenues, EPCA Emergency Management Grant, $32,709. Hazmat Grant, $6,000. EMPG Emergency Management Grant, $11,837. Total revenues, $50,546. Levy would be $46,602.57. Under elections, wages and salaries, $700. Social Security, $43.40. Retirement share, $5. Medicare, $10.15. Health insurance share, $100. Office supplies, $1,800. Printing, $90,000. Mileage and travel, $700. Total expenses, $98,358.55. And that would, no revenue, so the levy is the same. Information Systems Department. Wages and salary, $400,328.86. On-call pay, $14,800. Sick leave over 120 days, $600. Social Security, $24,820.39. Retirement, $28,823.68. Medicare, $5,804.77. Health insurance, $117,131.16. Professional services, $556,010. Telephone, $870. Fax, $1,500. Repair and maintenance, $2,500. Office supplies, $200. Postage, $100. Small item of Equipment, 15,000. Continuing education, 2,500. Membership dues, 150. Meal reimbursement, 80. Lodging, 1,000. Mileage and travel, 1,000. Total expenses, $1,173,218.86. Under revenue, computer system revenue is $48,850. Total levy, $1,124,368.86. Under the treasurer, wages and salary, $139,824.71. Social Security, $8,669.13. Retirement, $10,067.38. Medicare, $2,027.46. Health insurance, $56,495.52. Miscellaneous bank charges, $4,000. Telephone, $360. Office supplies, $2,800. Postage, $4,000. Printing, $2,000. Small items of equipment, $300. Publication legal notices, $1,600. Membership dues, $100. Registration fees, $600. Meal reimbursement, $40. Lodging, $760. Mileage and travel, $500. Fuel, $300. Total expenses, $234,444.20. For revenue, treasurer fees, $6,000. Total levy would be $228,444.20. Under facilities, wages and salaries, $314,279.78. On-call pay, $14,799. Social Security, $19,485.35. Retirement, $22,628.14. Medicare, $4,557.05. Health insurance, $85,201.32. Utility services, $230,000. Heat, $100,000. Telephone, $300. Other utility services, $12,000. Snow removal, $9,000. Repair and maintenance, $74,000. Office supplies, $500. Small items of equipment, $4,000. Shredding services, other office supplies, $4,000. Continuing education, $1,500. Annual inspections, $25,000. Meal reimbursement, $150. Lodging, $500. Mileage and travel, $1,400. Repair and maintenance supplies, $85,000. Security systems, $15,000. Impound shed, $3,500. Jail repair, $10,000. Grand total expenses, $1,036,800.64. No revenue, so levy is the same. Security screening, wages and salary, $151,091.20. Overtime, $9,000. Social Security, $9,367.66. Retirement, $27,951.87. Medicare, $2,190.82. Health insurance, $56,495.52. Continuing education, $1,840. Clothing and uniform, $1,500. Total security is $259,437.07. No revenue, levy the same. Property and liability insurance, $452,000. Revenue of $275,000. Total levy, $177,000. Workman's comp, $400,000 for expense, $289,000 for revenue, for a levy of $111,000. Unemployment compensation, $50,000 for expense, $50,000 for revenue, zero levy. Health insurance deductible, $501,000. Register of deeds, wages and salaries, $190,279.48. Social Security, $11,797.33. Retirement, $13,712.12. Medicare, $2,759.05. Health insurance, $84,743.28. Telephone, $522. Office supplies, $2,000. Postage, $500. Other office supplies, $190. Mileage and travel, $3,800, for a total expense of $310,291.26. Revenue, register deeds fees, $214,000, for a total levy of $96,291.26. Land records, wages, $213,554.43. Social Security, $13,240.37. Retirement, $15,375.92. Medicare, $3,096.54. Health insurance, $84,743.28. Professional services surveyor, $33,600. PLSS maintenance surveyor, $20,000. WCSA membership surveyor, $100. Surveyor supplies surveyor, $500. Telephone, $700. Office supplies, $300. Postage, $100. WLIP BB grant training, $1,000. Membership dues, $400. Registration fees, $2,000. Meal reimbursement, $250. Lodging, $2,670. Mileage and travel, $2,000. Print services, CSM, $220. Total expenses, $393,850.54. For revenue, digital map copies, $150. Surveyor CSM revenue, $8,000. WLIP BB grant training, $1,000. Total revenues, $9,150. Total levy, $384,700.54. Land records public access, $60,000 for expense. No line detail of $62,395.71. Total expenses, $122,395.71. Under the revenue side, retained fees, $6,000. Fund balance applied, $116,395.71, for total revenues, $122,395.71. Levy is $0. Land record retained fees. Retained fees for fiddler maintenance, $60,000. Repair maintenance, $60,000. Training, $5,000. No line detail, $20,000. Another no line detail of $24,499.86. Total expense, $169,499.86. For revenue, fund balance applied, $153,499.86. Retained fees of $16,000. Total revenue, $169,499.86. Levy is $0. WLIP grant. ESRI software maintenance, $70,000. Orthophotography, $100,000. No line detail, $93,966.35. Total expenses, $263,966.35. Under revenue, WLIP BB grant is $80,000. Fund balance applied, $183,966.35. Total revenue, $263,966.35. $0 levy. Tax deeds, $8,000 expense. No revenue, levy is the same. County share uncollected property tax, $2,000. No revenue, levy the same. Sheriff administration, wages and salaries, $2,305,686.02. Overtime, $138,650. Additional compensation, $36,127.25. Holiday pay, $8,382. Social Security, $145,192.42. Retirement share, $375,451.34. Medicare, $33,956.29. Health insurance, $745,051.14. Investigator, $26,900. Telephone, $24,420. Personal recruitment, $500. Office supplies, $3,000. Postage, $2,500. Printing, $390. Small items of equipment, $14,500. Film and photo, $500. Cease, $3,000. Utilities impound shed, $2,600. Publications, legal notices, $210. Continuing education, $21,310. Registration fees, $1,000. Random drug alcohol test, $8,210. Mileage travel, $16,500. Clothing allowance, $20,250. Insurance augmentation, $27,024. Communication equipment repair, $6,929. Fuel, $110,000. Squad car expense, $35,600. Vehicle towing, $2,500. Capital outlay SWAT, $19,800. Capital outlay radar video camera, 0. Capital outlay vests, $10,000. Total expenses, $4,146,139.46. For revenues, we have law enforcement instruction, $20,160. Civil process, $19,000. Sheriff's office revenues, $4,500. MEG reimbursement, $4,000. Insurance reimbursement, $15,000. CEASE program reimbursement, $500. Sheriff's fees, overtime, $49,450. Towing, $1,500. Vests, $3,000. Total revenue, $117,110. Total levy, $4,029,029.46. The badges, $4,200 expense. For the DARE contributions, $4,200 revenue. Levy is 0. For escape, $55,000 expense. Non-lapsing applied, $55,000 revenue, 0 levy. Dispatch administration, wages and salary, $518,835.40. Overtime, $68,547. Additional compensation, $47,741.90. Social Security, $35,127.79. Retirement, $37,356.15. Medicare, $8,215.37. Health insurance, $175,685.76. Telephone, $6,000. Personal recruitment, $150. Office supplies, $2,000. Small items equipment, $1,150. Continuing education, $6,100. Uniform allowance, $4,000. Total expenses, $910,909.37. No revenue, levies the same. Support services, electricity, $10,500. Repair and maintenance, $17,200. Radio, $45,000. Rent, $49,415. Total expenses, $122,115. No revenue, levies the same. Highway safety, $50 per diem, $210. Registration fees, $80. Meal reimbursement, $50. Lodging, $100. Mileage and travel, $225. Total expenses, $665. No revenue, levy the same. Jail administration wages, $1,312,119.68. Jail entry coordinator with benefits, $77,119. Overtime, $57,475. Additional compensation, $36,600. Holiday pay, $3,414.72. Social Security, $78,259.33. Retirement, $88,246.60. Medicare, $18,302.59. Health insurance, $379,618.98. Interpreter, $6,200. Telephone, $2,436. Personal recruitment, $500. Office supplies, $2,000. Small items of equipment, $7,500. Continuing education, $8,430. Jail operating supplies, $20,000. Meal supplies, $338,068. Vending supplies, $500. Clothing and uniforms, $9,405. Inmate medical, $353,637. Repair maintenance, $3,330. Inmate programming, $2,200. Electronic monitoring, $10,000. Inmate mental health, $50,926.39. Blood alcohol testing, 1,500. Total expenses, $2,867,788.29. For revenues, prisoner phone fees, 46,000. Board of Prisoners, 472,600. Deb Tech inmate vending, 12,000. Inmate medication, 11,500. Electronic monitoring, 26,500. Booking fee revenue, 100. Daily fee revenue, 18,000. Municipal holds, 500. SSA incentive, 1,200. Convicted felons DNA, 1,200. Warrant fee, 5,000. OWI blood draw, 1,100. Opioid fund transfer, $86,472.40. Total revenues, $682,172.40. Total levy, $2,185,615.89. Have you had enough yet? Child support, wages and salaries, $430,248. Sick leave over 120 days, 1,200. Social Security, 26,675 and 38 cents. Retirement, 30,977 and 86 cents. Medicare, $6,238.60. Health insurance, $152,721 and 12 cents. Family Court Commissioner, 4,500. Interpreter, 3,000. Clerk of Court, 27,130. Sheriff's Service fees, 7,000. Legal, Corp Counsel, 20,000. Telephone and fax, 1,400. Repair and maintenance, 2,750. Genetic testing, 2,000. BVS fees, 50. Transport fees, Sheriff's Department, 500. Office supplies, 3,000. Postage, 4,500. Host on demand, 450. Publications, legal fees, 150. Continuing education, 2,500. Membership fees, 250. Copies, 150. Total expenses, $727,390.96. Revenues, state reimbursements, $638,867.87. Child support program income, 900. Blood test recoupment, 750. Total revenues, $640,517.87 for the levy of $86,873.09. MCO payment expense, $402,782.57. No revenue, levy is the same. Veterans relief, mileage and travel, $4,000. No revenue, levy is the same. Veterans transportation, mileage, meal reimbursement, 0. Oh, I'm sorry, that was all zeros. Veteran service officer, wages and salaries, $120,552 and 85 cents. Social Security, $7,474 and 28 cents. Retirement, $8,679 and 81 cents. Medicare, $1,748 and 2 cents. Telephone, $350. Office supplies, $500. Small items of equipment, $200. Membership dues, $300. Registration fees, $400. Advertising, $1,000. Lodging, $1,000. Mileage and travel, $2,500. Total expense, $144,704.96. For revenue, state CVSO grant of $13,750. Total levy, $130,954.96. Care of veterans' graves, no line detail of expense of $10,000. No revenue, levy the same. Library, Winding Rivers is $10,854. Local is $606,804 and 24 cents. Total expenses, $617,658 and 24 cents. No revenue, levy is the same. Parks and Rec Commission, wages and salary, $99,068. $100 per diem, 0. $50 per diem is $3,925. Social Security, $6,142.22. Retirement, $5,264.06. Medicare, $1,436.49. Health insurance, $28,247.76. Professional fees, $17,000. Electricity, $5,000. Telephone, $700. Repair maintenance, $11,000. Excuse me, park improvements, $8,000. Office supplies, $150. Postage, $100. Publication legal fees, $300. Continuing education, $700. Membership dues, $500. Advertising and marketing, $2,000. Meal reimbursement, $100. Lodging, $300. Mileage and travel, $4,000. Fuel, $3,500. University, $10,000. Equipment, $13,000. Total expenses, $220,433.53. For revenue, parks, $46,000. Park improvement donations, $1,000. Park promotional sales, $4,000. Total revenue, $51,000. Levy, $169,433.53. Economic development is all zeros. Bead grant is zeros. Snowmobile trails, special projects, $73,000. Trail maintenance, $77,730. And for a total of $150,730. For revenues, snowmobile trails, $77,730. DNR grants, $73,000. Total revenue, $150,730. Zero levy. County fair, $24,000. Expense, no donation. Levy is the same. Digital media, TV studio, wages and salary, $208,771. I'm sorry, $208,071.61. Social Security, $12,944. Retirement, $14,981.16. Medicare, $3,017.04. Health insurance, $22,964.64. Telephone, $2,185. Repair and maintenance, $1,000. Office supplies, $200. Postage, $200. Continuing education, $1,000. Membership dues, $1,000. Registration fees, $8,000. Advertising and marketing, $30,000. Meal allowance, $200. Lodging, $1,000. Mileage and travel, $3,250. Total expenses, $309,969.89. No revenue, so levy is the same. TV studio voluntary gifts is zero. UW Extension, wages and salary, $26,137.38. Social Security, $1,620.52. Retirement, $1,881.89. Medicare, $378.99. Health insurance, $5,741.16. Professional services, $129,012. Telephone, $2,106. Office supplies, $1,500. Postage, $1,800. Membership dues, $500. Registration fees, $500. Mileage and travel, $8,000. Education supplies, $3,000. Total expenses, $182,177.94. No revenue, so levy is the same. Water quality education fund is zero. Patent educational is zero. Juntos is zero. Community garden is zero. Youth education is zero. Non-metallic mining reclamation, $1,000 expense, and professional services reimbursement of $1,000 for revenue. Levy is zero. Land and water management, Buffalo Trempealeau Farmers Network, $40,000 expense, a share cost payment of $40,000 for revenue. Levy is zero. County cost share, $70,000 expense, zero revenue, $70,000 levy. Tree and shrub. Professional services, $30. Office supplies, $19,000. Postage, $120. Advertising, $100. Tree and shrub program expenses, $2,000. Total expenses, $21,250. Revenue, tree and shrub program, $21,250. Levy is zero. Department of Land Management, wages and salary, $321,941.99. $100 per diem, $500. $50 per diem, $1,800. Social Security, $19,960.40. Retirement, $23,179.82. Medicare, $4,668.16. Health insurance, $90,942.48. Professional services legal, $22,000. Professional services inspector, $110,000. Telephone, $202,500. Repair maintenance, $200. Office supplies, $4,500. Postage, $4,400. Newsletter printing and postage, $3,000. Small item of equipment, $300. Publications, legal notices, $3,000. Continuing education, $4,500. Membership dues, $2,500. Subscriptions, $100. Meal reimbursement, $500. Lodging, $1,800. Meal and mileage and travel, $16,000. Other operating supplies, 911 signs, $4,000. Fuel, $5,000. Deed recording fees, $100. Total expenses, $647,392.85. Revenues, state grant of $167,587. Non-metallic mining, $65,000. Building permit fees, $108,000. UDC seal fees, $2,000. Zoning permit fees, $28,000. Public hearing fees, $3,800. Sanitary permits, $27,000. County sanitary permits, $400. Uniform number permit fees, $3,000. Well permits at 15% is $3,000. Permit fees for ag, $7,500. Total revenues, $415,287. Levy of $232,105.85. Lake Protection and Monitoring Network, expenses of $10,000. Professional services, revenue of $10,000. Levy is $0. Multi-discharge variance, expenses is $89,167.40. Fund balance carried over for revenue is $89,167.40, $0 levy. Conservation aids, $4,000 expense. Under the revenue, fish and game is $2,000, club contribution is $2,000, total of $4,000 revenue, $0 levy. Mississippi River Regional Planning Commission, membership fee, $14,674. No revenue, so levy is the same. Department of Land Management Vehicle, repair and maintenance, $8,000 expense. DLM mileage revenue, $8,000, levy is $0. Building inspection is $0. Comprehensive planning, contracted services, $70,000. Non-lapsing fund for revenue is $70,000, levy is $0. Wisconsin Fund septic system, $5,000 expense. Wisconsin Fund grant of $5,000 for revenue, $0 levy. Miscellaneous expenses, $10,000. Miscellaneous revenue of $10,000, levy is $0. Contingency fund, $110,000. Adjustment from 3% to 2% increase, $75,448 of revenue, so a total levy of $34,552. All right. For Health Department, wages and salaries, $47,533.20. Social Security, $2,947.06. Retirement, $3,422.39. Medicare, $689.23. Health insurance, $11,890.94. Telephone, $315. Continuing education, $1,000. Total expenses, $67,797.82. For revenue, infrastructure grants, $67,457.93 for a levy of $339.89. Under public health, wages and salary, $200,812.73. $50 per diem is $2,000. Social Security, $12,450.39. Retirement, $14,458.52. Medicare, $2,911.78. Health insurance, $84,059.84. Interpreters, 5,000. Professional services, 191. Telephone, 1,500. Office supplies, 300. Postage, 300. Small items of equipment, 300. Membership dues, 120. Meal reimbursement, 100. Mileage and travel, 500. Education supplies, 100. Total expenses, $325,104.26. For revenue, public health nurse miscellaneous, $49,644.11. And levy of $275,460.15. Under bioterrorism, wages and salaries, $16,303.50. Social Security, $1,010.82. Retirement, $1,173.85. Medicare, $236.40. Health insurance, $3,934.61. Telephone, $130. Office supplies, $1,548.54. Small items of equipment, $2,761.95. Mileage and travel, $1,125. Total expense, $28,224.67. One grant for revenue of $23,193.41. Total levy, $5,031.26. TB dispensary, wages and salaries, $4,643.48. Social Security, $287.90. Retirement, $334.33. Medicare, $67.33. Health insurance, $2,824.64. Interpreters, $191. Telephone, $17.40. Mileage, $100. Medical supplies, $200. Total expense, $8,666.08. TB revenue of $3,179.26. Total levy, $5,486.82. Under WIC, wages and salaries, $131,960.28. Social Security, $8,181.54. Retirement, $9,501.14. Medicare, $1,913.42. Health insurance, $59,216.95. Interpreters, $1,000. Professional services, $64,480. Telephone, $1,200. Office supplies, $600. Postage, $400. Continuing education, $700. Mileage, $350. Medical supplies, $1,000. Educational supplies, $100. Indirect, $32,824.40. Total expenses, $313,427.73. A WIC grant for revenue of $257,221, making the levy $56,206.73. Tobacco control is all zeros. Public health workforce is zeros. Radon. Wages and salaries, $8,572.20. Social Security, $531.48. Retirement, $617.20. Medicare, $124.30. Health insurance, $10,592.40. Telephone, $71.25. Office supplies, $375. Publications, legal notices, $300. Total expenses, $21,183.83. A grant for revenue of $500, making the levy $20,683.83. WIC Farmers Market, wages and salaries, $649.38. Social Security, $40.26. Retirement, $46.76. Medicare, $9.42. Health insurance, $282.46. Postage, $150. Printing, $100. Indirect, $161.41. Total expenses, $1,439.69. a grant under the revenue for $1,208, making the levy $231.69. TNC well water, wages and salaries, $7,235.28. Social Security, $448.59. Retirement, $520.94. Medicare, $104.91. Health insurance, $3,107.10. Professional services, $3,000. Telephone, $62.70. Postage, $150. Mileage and travel, $300. Total expenses, $14,929.52. A grant under the revenue for $10,200, making the levy $4,729.52. And the Fit Family SNAP is 0. The agent status, wages and salaries, $68,577.27. Social Security, $4,251.79. Retirement, $4,937.56. Medicare, $994.37. Health insurance, $30,054.17. Interpreters, $500. Telephone, $1,200. Office supplies, $100. Postage, $300. Small items of equipment, $400. Continuing education, $1,600. Membership dues, $100. Mileage and travel, $5,000. Vehicle, $2,000. Fuel, $2,000. Indirect, $16,819.71. Total expenses, $138,834.87. Under the revenues, a grant of $110,000, making the levy $28,834.87. Under the car seat program, wages and salaries, $1,465.80. Social Security, $90.88. Retirement, $105.54. Medicare, $21.25. Telephone, $5.22. Small items of equipment, $3,000. Training, $550. Total expenses, $5,238.69. There's a grant under revenues for $3,000, making the levy $2,238.69. For WIC breastfeeding, salaries and wages, $2,174.17. Social Security, $134.80. Retirement, $156.54. Medicare, $31.53. Health insurance, $522.56. Professional services, $15,285.17. Telephone, $830. Office supplies, $100. Medical supplies, $100. Indirect, $292.45. Total expenses, $19,627.22. There's a grant in the revenue of $18,780. Total levy, $847.22. Lacrosse water grant is 0. Communicable disease, wages and salaries, $1,473.47. Social Security, $91.36. Retirement, $172.21. Medicare, $21.37. Health insurance, $894.01. Professional services, $18,316.80. Office supplies, $200. Postage, $50. Total expenses, $21,309.22. A grant under the revenue for $3,820, making the levy $17,489.22. MCH grant, wages and salaries, $20,188.42. Social Security, $1,251.68. Retirement, $1,453.57. Medicare, $292.73. Health insurance, $4,468.15. Telephone, $160. Office supplies, $500. Small items of equipment, $1,650. Continuing education, $1,000. Mileage and travel, $200. Total expenses, $31,164.55. A grant in the revenue for $16,354.01, making the levy $14,810.54. Adult health prevention, wages and salary, $5,737.64. Social Security, $355.73. Retirement, $413.11. Medicare, $83.20. Health insurance, $1,633. Telephone, $9.40. Office supplies, $300. Small items of supply, small items of equipment, $1,000. Membership dues, $1,000. Total expenses, $10,532.08. A grant in the revenue for $5,255, making the levy $5,277.08. MCH match previous 6A. Wages and salary, that's all zero. Immunizations, wages and salary, $60,584.16. Social Security, $4,362.06. Retirement, $4,362.06. Medicare, $878.47. Health insurance, $25,421.76. Professional services is $191. Telephone is $575. Purchase services, $800. Office supplies, $100. Postage, $100. Medical supplies, $500. Total expenses, $97,268.67. Immunization revenue of $11,378. Total levy, $85,890.67. Childhood lead, wages and salaries, $682.86. Social Security, $42.34. Retirement, $49.17. Medicare, $9.90. Health insurance, $564.93. Professional services, $1,600. Office supplies, $179.53. Postage, $25. Printing, $10. Small items of equipment, $50. Medical supplies, $50. Total expenses, $3,263.73. A grant under the revenue for $3,263.73 for a levy of zero. Carbon monoxide wages, $4,857.60. Social Security, $301.17. Retirement, $349.75. Medicare, $70.44. Health insurance, $1,327.06. Office supplies, $4,380. Total expenses, $11,286.02. A grant of $10,000 makes the levy $1,286.02. Under Human Services, Economic Support Services, wages and salaries, $424,795.07. Social Security, $26,337.29. Retirement, $30,585.25. Medicare, $6,159.53. Health insurance, $220,698.96. Telephone, $818. Office supplies, $1,866. Training, $200. Mileage and travel, $6,800. Total expenses, $717,760.10. Under the revenue, a grant or revenue is WREA of $589,747.83. Total levy, $128,012.27. Adult Protective Services, wages and salaries, $77,153.18. On-call pay, $1,370. Social Security, $4,783.50. Retirement, $5,555.03. Medicare, $1,118.72. Health insurance, $32,350.77. Professional services, $2,500. Telephone, $653. Purchase services, $1,000. Office supplies, $50. Training, $740. Mileage and travel, $2,500. Fuel is $50. Elder abuse, $10,000. Mississippi Valley, $2,000. Total expenses, $141,824.20. Under revenues, base of 40,000, elder abuse direct services fund, $16,695. APS allocation, $37,695. Total revenues, $94,392. Total levy, $47,432.20. Under child care, $12,188. And a child care certification revenue of $12,188, zero levy. Aging and Disability Resource Center, wages and salaries, $371,767.89. Social Security, $23,049.61. Retirement, $24,739.77. Medicare, $5,390.63. Health insurance, $117,213.96. Interpreter, 100. Telephone, 1,900. Alzheimer's AFC SP, 10,000. Office supplies, 1,000. Training, $3,869. Membership dues, 300. Advertising, 8,000. Mileage, 1,700. Fuel, 1,000. Total expenses, $570,030.86. Under revenue, Resource Center, $345,478. AFC SP, $16,062. Total revenue, $361,540. Total levy, $208,490.86. Recovery Court, 85 for wages and salaries, $85,434.13. Social Security, $5,296.92. Retirement, $6,151.26. Medicare, $1,238.79. Health insurance, $16,953. Telephone, $600. Training registration fees, $4,080. Supplies and testing, $10,000. Lodging, $926. Sorry, meal reimbursement, $926. Lodging, $3,332. Mileage and travel is 0. Incentives, $4,000. MAT and client services, $5,000. RC incentives, $9,175.06. Volunteer recognition, $450. Total expenses, $152,637.16. TAD grant under revenues for $110,000. Participant fees, $500. Total revenue, $110,500. Total levy, $42,137.16. HS administration, $570. Wages and salaries, $573,606.38. $100 per diem, $300. $50 per diem, $5,000. Social Security, $35,563.60. Retirement, $41,299.66. Medicare, $8,317.29. Health insurance, $120,937.44. Professional services, $3,000. Telephone, $2,238. Repair and maintenance, $11,710. Office supplies, $10,000. Postage, $5,500. Publication legal fees, $25,000. Training, $6,000. Dues, $1,000. Social services board mileage, $700. Mileage and travel, $3,500. Fuel, $50. Vehicle maintenance, $5,000. Total expenses, $833,747.37. Under the revenues, there's a WREA, $264,959.17. A BCA DCF for $75,000. BCA-DHF of $270,000. And a WIMCR CCS of $210,000. Total revenues, $819,959.17. Total levy, $13,788.20. Family and Children's Services, wages, $766,272. Overtime is 0. On-call, $18,000. Social Security, $47,508.86. Retirement, $55,171.58. Medicare, $11,110.94. Health insurance, $214,500. $521.48. Interpreter, $9,000. Telephone, $9,500. Office supplies, $250. Publications, legal notices, $250. Training, $7,700. PDS partnership fees, $1,328. Mileage, $18,000. Fuel, $6,000. Children and families, $50,000. Supervised independent living, $3,000. Secure, $200,000. Kinship assessments, $2,500. Kinship, $60,000. Foster parent training, $300. AODA testing, $16,000. TSSF, $32,859.09. TSSF 3632 BUL safety supports, $27,216.75. Institutional care BCA, $250,000. Adam Walsh fingerprinting, $250. Foster base, $170,000. PSSF, $38,069. ESACWIS charges, $3,549. Supervised visitation and respite, $20,000. CST, $62,545.59. Subsidized guardianship, $40,000. Paper services, $500. Total expenses, $2,141,402.29. Under the revenue, base of $562,523. Kinship benefits, $91,950. Kinship assessments, thank you for the last one. Kinship benefits, $91,950. Kinship assessments, $9,195. PSSF, $38,069. TSSF, $60,075.75. Parental contributions, $500. Child support collections, $30,000. Subsidized guardianship, $40,000. And CST, $52,036.40. Total revenue, $884,349.22 for a levy of $1,257,053.07. Children with special needs, wages and salaries, $729,531.70. Social Security, $45,230.97. Retirement, $52,526.28. Medicare, $10,578.21. Health insurance, $189,809.64. Interpreter, $500. Telephone, $4,940. Office supplies, $250. Training, $6,805. Membership dues, $800. Mileage, $3,000. Fuel, $900. Birth to 3, $200,000. CLTS County, $67,414. CCOP, $101,225. CLTS Osseo and GT schools, 0. CCS vendor, $1,500,000. CCS operations, $75,000. Total expenses, $2,988,510.80. Under the revenue, CLTS state of $67,414. Birth to 3, $85,485. Birth to 3 public charges, $1,500. Case management, CLTS, $790,311.68. Birth to 3 therapy forward health, $30,000. CCS provider reimbursement, $1,500,000. CCS case management, $40,000. CCOP non-CLTS, $101,225. And WIMCR CCS of $325,000. Total revenue, $2,940,937.68. For a levy of $47,575.12. Under behavioral health, wages and salaries, $376, $457.16. Social Security, $23,340.34. Retirement, $27,104.92. Medicare, $5,458.63. Health insurance, $159,018.51. Interpreter, $150. Telephone, $2,400. Office supplies, $1,000. Training, $3,675. Membership dues, $550. Mileage and travel, $2,500. Fuel, $4,000. BH substance abuse testing, $250. Participant mileage miscellaneous, $1,000. State institutions, $163,744. Northwest Counseling, $71,568. Residential, $150,000. CSP, $64,000. Outpatient, $3,000. Inpatient, $23,000. IMD, $150,000. CCS, $150,000. Former out-of-county treatment, $10,000. AODA prevention, $18,620. CCS operations, $8,000. Total expenses, $1,418,836.56. Under revenues, BCA of $669,133. MH Block State, $15,569. AODA Block, $53,091. Clerk of Court, IDP, $18,637. CBRF Public Charges, $12,000. AODA City of Arcadia, $3,415. CSP Forward Health, $100,000. CSS, $50,000. CCS Case Management, $62,640. Consolidated Mental Health, $55,093. Wimker CCS, $192,000. Total revenue, $1,231,778. Total levy, $187,058.56. Senior Services, State Legal Benefit Assistance, wages and salary, $44,624.74. Social Security, $2,766.73. Retirement, $3,212.98. Medicare, $647.06. Health insurance, $7,865.39. Telephone, $174. Training, $650. Dues, $275. Mileage and travel, $250. Total expenses, $60,465.90. Under the revenue, state pharmaceutical assistance, $3,551. SHIP, $4,200. ADRC, $23,000. And MIPAA, $2,334. Total revenue, $33,085. Levy, $27,380.90. Preventive health, 3D, $3,500. Under revenue, Title 3D, preventive health, $3,100. Strong bodies donation, $50. Total revenue of $3,150. Levy is $350. Title 3B, supportive services, wages and salaries, $30,923.24. Social Security, $1,917.24. Retirement, $2,226.47. Medicare, $448.39. Health insurance, $7,446.41. Telephone, $35. Supportive supplemental services, $3,000. Mileage and travel, $50. Total expenses, $46,046.75. The revenue, Title 3B supportive services, $35,577.54 for a levy of $10,469.21. Under specialized transit assistant program, wages, secretary bookkeeper, $55,740.17. Social Security, $3,455.89. Retirement, $1,448.55. Medicare, $808.23. Health insurance, $4,812.37. Telephone, $182. Publications, legal notices, $350. Vehicle maintenance, parts and repairs, $7,500. Fuel, $8,500. Recognition, $900. Total expenses, $83,697.21. Under the revenue, motor vehicle, 85.21 grant of $79,889. Business copay of $1,000, van copay $1,272.95, other receivables $900. Total revenue $83,061.95 for a total levy of $635.26. And then the 3E National Family Caregiver Support Wages Mobility Manager Outreach $711.28, Social Security $44.10, Retirement $51.21, Medicare $10.31. Health insurance, $273.53. Telephone, $8.70. Supportive supplemental services, $7,263. Training, $50. Respite, $15,138. Total expense, $23,550.13. Under the revenue, we have $18,000 for a levy of $5,550.13. Under Title III, C1 Congregate Nutrition, wages and salaries, $18,804.24. Wages for site managers, $17,024.02. Social Security, $2,221.35. Retirement, $2,579.63. Medicare, $519.51. Health insurance, $4,018.81. Professional services dietitian, $985. Telephone, $178.50. Raw food and contracted, $9,500. Food provider, $85,000. Office supplies, $50. Printing is $50. Training is $700. Membership dues is $80. Mileage and travel, $800. Meal supplies, $150. Total expenses, $142,661.06. Under the revenue, I've got Title III C1 Congregate Nutrition of $83,167. Congregate Nutrition Program income, $50,000. Total revenue, $133,167. Levy is $9,494.06. C2 home delivered meals, wages and salaries, $18,804.24. Hourly wages, home meal drivers, $52,417.37. Social Security, $4,415.74. Retirement, $1,353.91. Medicare, $1,032.71. Health insurance, $4,018.81. Professional services dietitian, $1,000. Telephone, $178.50. Food provider, $150,000. Office supplies, $50. Mileage for food delivery, healthcare center, $8,000. Meal supplies, $8,500. Fuel, $7,200. Mileage, $25. Equipment, $800. Total expenses, $257,796.28. Under the revenue, Title III C2 home delivered meals of $65,235. NSIP of $14,261. Senior Community Service Program, $7,677. Home delivered meals program income, $75,000. WWC HDM, $5,000. Fund balance applied of $0. Total revenues, $167,173. Total levy, $90,623.28. A jail assessment is $0. For highway maintenance of county trunk highway system, contractual, $1,904,375. Contractual supervision, $22,796. Total expense, $1,927,171. Under highway aids for revenue, $1,597,358. Total levy, $329,813. Winter maintenance, contractual, $704,430. No revenue, so the levy is the same. County road construction, is 0. Transfer out to Highway Enterprise Fund, County Aid Road Share, 400,000. No revenue, levy is the same. Co-aid Bridge Construction, local, $48,056.83. No revenue, levy is the same. Wildlife damages and claims, County Administrator, 500. Contracted services, $15,838.63. Mileage and travel, $4,556.76. Abatement materials, $1,363.11. Administration overhead, $3,214.20. Venison processing, $7,360. Claims, $8,000. Admin costs, venison processing, $333. Total expense, $41,165.70. Under the revenue, a DNR grant of $41,165.70, 0 levy. Nutrient management, incentive payments is $9,900. Soil testing, $10,000. Manure testing, $100. Total expenses, $20,000. A grant of $20,000, and the revenue levy is 0. TRM cost share is 0. LWRM cost share expense, $118,000. Revenue of the same, levy is 0. Notice of discharge, the budget is 0. Principal for long-term debt service, $4,150,000. 0 revenue, levy is the same. Bond expense, $3,525 is expense. 0 revenue, levy is the same. Yep. And interest expense, $1,475,524.08. 0 revenue, so levy is the same. Capital outlay. Server replacement, $13,000. PCs and laptops and tablets, $35,000. Interior signage, $6,000. Seal coat parking lot, $8,000. Jail plumbing decommissioning, $10,000. Conference room office furniture, $50,000. Government center office furniture, $250,000. Roll-up garbage door install, $5,000. Install stairs at loading dock, $13,000. Autonomous floor scrubber, $82,000. Rec facilities, economic development projects, $500,000. Petrick Park facilities updates, $25,000. Petrick Park road repairs, $75,000. Petrick Park play area, $20,000. Sheriff vehicles, $150,000. Sheriff mobile radios, $42,500. Sheriff flock cameras, $20,250. Road projects, $2,752,424. Bridge projects, $365,260. Total expenses, $4,422,434. Proceeds from long-term bonds under the revenue of $4,172,434. And transfer of general funds of $250,000. So total capital projects revenue is $4,422,434, so 0 levy. Enterprise funds healthcare center, no line detail, $28,311,070.65. Healthcare center revenue, $28,311,070.65, 0 levy. Highway administration, wages and salaries, $249,076. Overtime, $10,000. $100 per diem, $3,675. $50 per diem, $3,450. Medicare, $550. Health insurance, $192,416,000. $192,416. Oh my goodness. Professional services, $18,375. Telephone, $3,720. Drug and alcohol testing, 2,320. Office supplies, 1,230. Postage, 850. Continuing education, 5,840. Membership dues, 75. Advertising, 300. Subscriptions, $10,225. Meal reimbursement, 240. Committee mileage, travel, 2,500. Mileage and travel, 1,450. Vehicle, $17,799. Other miscellaneous other costs, $10,625. No line detail, $27,000. Total expenses, $561,716. Under the revenue, records and reports, state and local of $200,775. Records and reports, county, $358,191. Miscellaneous revenue, $250. Permits, $2,500. Total revenue, $561,716. Levy is zero. Under supervision, wages and salaries, $82,500. Health insurance, $48,930. Telephone, $2,000. Continuing education, $380. Meal reimbursement, $100. Vehicle, $18,062. Total expense, $151,972. The revenue from supervision, $129,176. Miscellaneous revenue, $22,796. Total revenue, $151,792. Levy is zero. Under radio expenses, general maintenance expense, $20,500. Under the revenue, radio reimbursement, $3,400. Miscellaneous revenue, $17,100. Total revenue, $20,500. Levy is zero. General public liability expense, $30,375. Under the revenue, GPL reimbursement, $20,391. Miscellaneous revenue, $9,984. Total revenue, $30,375. Zero levy. Highway fringe benefits, $2,018,700. Fringe benefit revenue, $2,018,700. Zero levy. Operation of equipment, no line detail, $2,641,656. Under revenue, operation of equipment, $2,494,319. Machinery storage, $134,723. Salt storage, $4,114. Miscellaneous revenue, $8,500. Total revenue, $2,641,656. Zero levy. Bituminous operations, $3,637,172. Revenue is the same, levy is zero. Maintenance for the county trunk highway system, contractual is $1,824,813. And the revenue is the same for levy of zero. Winter maintenance for county trunk highway systems, contractual is $675,000. The revenue of the same for zero levy. Co-aid road construction, $10,068,905. For expense, for revenue, grants from local governments is $26,000. Revenues from CHIPS is $890,481. Federal aid contractual, $2,400,000. Reimbursement from 25 capital debt proceeds, $2,500,000. Reimbursement from 2026 capital debt proceeds, $2,752,424. Services on county trunk highways, $1,500,000. Total revenues, $10,068,905. Levy is zero. Under the bridge construction, contractual $365,260. Revenue of the same, levy is zero. State highway maintenance, $2,556,515. Revenue of intergovernmental revenues is the same, levy is zero. Town, cities, villages maintenance, $1,458,824. Revenue is the same, levy is zero. Co-aid road construction local, $957,000 and a $43,000 for making $1 million. And the grant from local governments is $600,000. And also transfer from other funds is $400,000 for $1 million revenue, so levy is 0. Governmental customers, $575,228 for an expense. Miscellaneous revenue is the same, levy is 0. Miscellaneous maintenance, $14,369. Miscellaneous revenue of the same, levy is 0. Dog fund, no line detail, $12,000. Revenue of the same, levy is 0. Grand totals, expenses, $100,669,723.54. Total revenues, $82,275,591.03. Total levy, $18,394,132.51.
Thank you. You can have it. Well, you've heard the budget, first reading of the budget, we'll come back to that later.
1 hour, 33 minutes.
We're gonna go to item C, item D, county board supervisors, Bridget Turner, Dick Miller, and then the county board supervisor compensation. You wanna read that one?
You want me to read that?
Yes. Hey, you haven't done nothing, you haven't read anything yet.
You've done such a great job reading today.
Whereas Wisconsin statutes 59.10 parentheses 3F and 59.13 parentheses 2 provide for the establishment of county board supervisor compensation at the annual November meeting of the board. And whereas a resolution of the county board dated July 5, 2019 set a limit of $50 per committee meeting under 3 hours and $100 per committee meeting over 3 hours, $100 for a county board meeting at the cap of $250 per day for all meetings attended. And whereas per diem compensation rates have not been adjusted since 2019, while other costs have since risen. And whereas the current language penalizes supervisors for attending at meetings on those rare occasions when 3 committee meetings or when a full board meeting, when a full county board and a committee meeting must be scheduled within the same 24-hour period. Now be it resolved that the Trempealeau County Board of Supervisors amend the 2019 resolution and increase the per diem rate to allow county board supervisors the following per diems: $70 per committee meeting under 3 hours, $125 per committee meeting over 3 hours, $125 county board meeting, cap of $320 per day for all meetings attended. Resolution drafted by Bridget Turner and Dick Miller.
Okay. You've heard the resolution. Is there a motion?
I'll make a motion to approve.
Motion to approve. Second to that?
Second.
Second. Discussion?
Mr. Chair,
Yeah.
in regard to how this is written, we cannot raise our own wages, so shouldn't there be a stipulation in there of the time frame that this takes effect either?
It automatically, nothing happens till next April.
But where does it say that? Where does it say that in the resolution?
Should that be added?
Yeah.
An amendment to it? Yeah.
Yes, and that was an omittance by Dick and I. So I would like to add a whereas that states that this will not take effect until after the election in April.
How about doing a positive and saying it will take effect as of May 1st?
Well, that actually takes effect when they get sworn
When we
in at
have
the
the
next board meeting.
Now you're adding confusion to the monthly statement, because some will be before and some will be after. That's why I suggest
Well,
May.
all these board members are still on until they're sworn in on whenever the board meeting is in April, whenever that is. I'm not sure when it is. Yeah.
It's
so,
the first week
anyway,
of us some.
want to read your amendment? It'll take effect at the next board meeting, at the next full county board in April.
Right.
Yeah.
And he'll
So at the April board meeting, it would go up from 100 to 100, what was it, 120? 125. It would go up $25 for a board meeting.
So, could somebody I won't support this amendment, but or this resolution, could you be more clear in what you're talking about when this takes effect?
It takes effect with the new board.
Okay,
which
does that
gets
need to be
sworn
written in this
Which gets sworn
resolution?
in on April 15th or whenever it is.
Okay.
Yeah, that would need to be added to
Okay,
this
well,
resolution.
I won't support this anyway, so,
So the amendment is
huh?
there's an amendment to the resolution to add verbiage to the what language that it takes effect in 2026 at the April board meeting. Second to that motion? Motion made and seconded that this takes effect on the board meeting in April. So, call the roll.
Is there any discussion about this?
Any
or no?
discussion at all?
Are we doing, so what are we voting on? To change it for April 15th for the being paid or to pass it?
We should be
Just
voting
for-
on the
just to add
amendment
this
that Bridget
amendment,
brought
just to
up.
add
Should
this
be
amendment.
first, the amendment, and then the main resolution should be
Yes.
voted on.
Yeah, just this amendment for now.
Okay.
So the amendment, it just a voice vote, isn't it?
Yeah, we probably could. Yeah, we could do a voice vote on the amendment. All those in favor of adding the paragraph, whereas it takes effect on April 15th, whatever it is, I'm not sure of the date. Whenever the board meeting is in April, whenever the new board is sworn in April. That's when it takes effect, so that's the motion. All those in favor signify by saying aye.
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 Opposed?
No.
No. 2 noes. Okay. Now we're back to the main motion. That passed.
Who made the original second? Bridget made it original. Who was the second?
Kelly.
Kellen.
For the original one. Was it Rich or?
Yeah, who made the original motion?
Kevin Adams.
Kevin Adams made the original motion to,
Bridget did and Kevin seconded.
okay. Bridget made the original motion. Supervisor Turner made the motion. Now we're back to the original motion with this amendment on it. So there,
Question, Mr.
any
Chair?
questions or any discussion?
How frequently has the past practice been that we've updated the costs? I know they've stated it's 6 years for this one. Is our past practice that we do it at that level, or is it just a haphazard
Actually, years
suggestion?
ago, if you want to go, board members used to get health insurance and everything. So things have really changed over the years, and now we went from 35 to 50, 6 years ago, 5 years ago, 6 years ago.
2019.
2018, we raised it from 35 to 50. And now they want to go from 50 to 75, which is probably,
Been almost 7 years, like you said.
yeah. So anyway,
Well, and this came about with an attempt rather than wait 10, 12, 15 years to increase these, that periodically that we look at this and that we increase them per the going rate. Not that this number cannot be adjusted, but we wanted to stay current with what other local governments and whatnot were doing. Dick, do you have anything else to add? Since you're on.
No, I think we need to, as a board, every 2 years prior to papers being taken out, to review our policy regarding per diems. And I think this is an attempt, though we haven't done it for, 6 years is what I hear, or something like that. I think it is proper and important that we do review these, because sometimes it becomes necessary to increase them if we wait too long, and then the increase perhaps results in some community concern regarding that. And I think if we can review it on a 2-year basis and maintain a proper level of funding for those people who are serving on the county board. And as you all know, that some of you have to drive a round trip a good hour and a half, perhaps 2 hours to and from, and that time you're not compensated for. So I think it's only reasonable that we maintain a level that's indicative of the time and expenses involved.
okay.
Thank
go
you.
ahead, Ms. Nutter.
I have a question for you and Bridget. Did you look at what how this compares to what other counties are receiving? County board members?
Yes, I looked at that, and.
Do you have the numbers?
It varies dramatically from county to county. Even within counties of our size, it varies dramatically. And we didn't have also all the information, such as other compensation that they may or may not be getting, such as health insurance or something like that. Some county supervisors are just paid a flat rate per month, but there was no information as to how many meetings do they attend for that flat rate per month. So it was kind of all over the board.
But you don't have the number, like you can't tell me how much a county board supervisor in Jackson County
I don't
gets
have that
per
with
diem.
me.
Okay.
I do have that. I can share that. The other thing that I wanted to note was that as far as the budget goes, this was not in the budget, and it roughly would be an additional $18,000 to $19,000 to do this, which equates to about 0.018 to 0.019% of the entire county budget. So I thought you probably would want to know that as well.
I just don't feel, I feel like it's kind of being tone deaf that we're taking away money and benefits from employees, yet giving ourselves, it wouldn't be us necessarily, but I can't support this at this time.
My only thing I have to say is that I just question the timing of this resolution of the day of the budget. It's just,
Well, it was
it's just,
an
that's all I
appropriate
have
time
to
to
say.
do it because it has to be done at this meeting prior to the election in April. So that's why it came forward now.
Actually, it has to be done prior to their taking out papers to run for. So anyway,
I think, on one hand, I think the increase is good, and I think this is like Supervisor Backer and Nutter said. Even though I do appreciate this, but at the same time, if we're possibly having to even the remote chance of having to make hard decisions when we have to maybe, with employees, we might have to make difficult decisions. Maybe take some benefits and or pay of any kind away. I can see where they're coming from. Maybe we should have done this at a later date. I know it wasn't on purpose, but right now during a budget, even for not taking any benefits away from employees, it's even the appearance of. So, thank you.
just again, it's either done now or it's not done until 2 years from now.
Mr. Chair?
Yes, go ahead.
Okay. I guess everybody can have their opinion in terms of the role. Are we volunteers entirely, or are we paid at least a stipend for our time? I think that the time we put in is valuable. And I think to underrate that is a mistake. That it is proper to consider moving ahead with this particular resolution. When you look at the board and it's someone that people have to have time to attend meetings and be involved and study the different issues that come ahead. And if that's not worth something, I'm sorry, I can't agree with that. It's worth a great deal. Thank you.
Okay. Any other comments? Not, we'll just call for the vote, and that's to approve the resolution as amended.
Dawn Trug,
Yes.
Robert Becker,
Yes.
Renee Lyon,
Yes.
Kellen Nelson,
Yes.
David Larson,
Yes.
Jeannie Nutter,
No.
Ron Johnson,
Yes.
Bridget Turner,
Yes.
Stacy Klein,
Yes.
Richard Sasha,
Yes.
Lori Severson,
Did we lose Lori?
I don't see her up there.
and
I
Andy
don't see her
Todd,
name listed.
No.
Richard Anderson,
No.
Kevin Adams,
No.
Dick Miller,
Yes.
Kevin Whalen,
Yes.
John Austin,
No.
1, 2, 3, 4, 5, 11 to 5.
11 to 5, it passes. Okay, go back to 6A2, amendment for Trumpealeau County Ordinance to include the Trumpealeau County Board Supervisors Code of Ethics. I'll turn that over to Susan.
Whereas Trempealeau County Board of Supervisors, hereafter the county board, hereby recognizes the importance of public trust in government and its officials and employees, that such trust is necessary to a well-functioning democracy, and that such trust is best created and encouraged through the defined and ethical conduct of its officials and employees. Whereas the county board further recognizes that the proper and ethical conduct in county government promotes orderly government affairs and furtherance of actions taken for public interest and purpose, enhanced confidence in governmental activities, and overall professionalism when performing county services and activities. Whereas the county board in May of 2025 affirmed its commitment to proper governmental functions through its request for the drafting of a Trumpealeau County Code of Conduct and County Ethics Code. Therefore, the Code of Conduct and Ethics Code have been since drafted and both being proposed amendments to the Trumpealeau County Ordinance, Chapter 2, Administration. Whereas the county board has reviewed and now finds that those amendments are acceptable and that they are consistent with and promote such conduct, ethics, and ideals important to county government. Whereas the county board is aware that through this drafting and review process, minor modifications of the Trumpealeau County Ordinance, Chapter 2, were discovered and determined to be necessary to reflect the standards and norms of the English language and to further the consistent and accurate interpretation of this chapter, and that the county board finds those changes appropriate for those reasons. And whereas that all such amendments and modifications are included within the attached version of the Trumpealeau County Ordinance, Chapter 2, also attached to this resolution. Now therefore be it resolved that the Trumpealeau County Board of Supervisors hereby fully approves, adopts, and ratifies the proposed Trumpealeau County Ordinance, Chapter 2, as referred herein, specifically including new subsections on the County Board Supervisor Code of Conduct and County Ethics Code. Be it further resolved that though this is the following that shall occur. Number 1, that the Trumpealeau County Ordinance, Chapter 2, Administration shall be amended to include the County Board Supervisor Code of Conduct and the county's Ethics Code as new subsections, and the remaining sections be renumbered as appropriate. Number 2, that the additional changes recommended to promote consistency in form and interpretation shall be included within the amended ordinance. Number 3, that a true and correct copy of the Trumpealeau County Ordinance, Chapter 2, fully reflective of and incorporating all approved changes and additional sections as discussed herein shall be included with the resolution. And number 4, that the Trumpealeau County staff are directed to take those steps necessary to carry out these changes now made to the Trumpealeau County Ordinance, Chapter 2, Administration, such as updating the electronic version of this ordinance, updating the employee handbook, and drafting forms for county use related to these changes, adopted by the Trumpealeau County Board of Supervisors this 3rd day of November, 2025, introduced by Exec Finance Committee, Dave Larson, Robert Becker, John Austin, Richard Seisha, Bridget Turner. Exec Finance, sorry.
Motion by Supervisor Nutter.
I'll second that.
Second by Supervisor Turner. Any discussion?
Mr. Chair?
Yes.
This resolution is asking us to basically reapprove the amendments to and the existing content of Ordinance Chapter 2. So I'm not opposed to the resolution, but there are some things in the ordinance that did not get updated that are that do need to be. For example, subsection C, UW extension number 4 and 5 refer to WTCO, which used to be under UW Extension's committee, but is no longer there. It is, I believe, under the Properties Committee.
So I did not do that because I wasn't charged with updating the committees or their
Okay.
duties. I would recommend that being updated. That's a different subsection. That is the committees of the county board, so 2.05. This is more of an update of 2.02 in addition to 2.07.
and an addition of 2.04. I would
Okay.
recommend that. There's also a couple other places
Correct.
where we haven't updated, just because we made that the transition between administrative coordinator to administrator. Yep, we do need to do that.
So this right now is just to vote on on those sections?
Exactly.
Okay.
Yep.
All right, thank
Yep.
you.
It's an excellent point, and it needs to get done, just a separate time.
Okay, any other comments? Hearing none, you want to call the roll?
Mr. Chair.
Yes.
Having spent no less than about 6 hours reviewing Susan's emails that she sends us and piles onto us for that, I would like to thank our Corp Counsel, Susan, for all the work that she's done in this, and to also realize that it's not over yet. So, thank you.
Okay. No further comments? Go ahead, call the roll.
Kevin Adams. Dick Miller.
Yes.
Kevin Whalen.
Yes.
John Austin.
Yes.
Don Trug.
Yes.
Robert Becker. Yes. Renee Lyon. Yes. Kellen Nelson.
Yes.
David Larson.
Yes.
Jeannie Nutter.
Yes.
Ron Johnson.
Yes.
Bridget Turner.
Yes.
Stacy Klein.
Yes.
Richard Sasha.
Yes.
Lori Severson. Andy Todd.
Yes.
Richard Anderson.
Yes.
16.
Thank you.
Passes. Environmental land use, rezone transition ag to industrial for Town of Gale, provision of Partners Cooperative.
Whereas Provision Partners Cooperative, Adams, Wisconsin landowner Nate Bennington petitioner has requested the rezone of a parcel of land in the town of Gale to expand an existing area and to construct a new fertilizer facility. Whereas the rezone is on approximately 28 acres, more or less, and whereas a public hearing was held pursuant to section 59.69, parentheses 5 of the Wisconsin statutes, and whereas the town of Gale supports the rezone request, and whereas the Environment and Land Use Committee moved to rezone part of this parcel from transitional ag TA to industrial I, and it appears that the zoning change request is appropriate under the circumstances. Now be it resolved that the county adopt the attached ordinance amending the zoning district boundaries as indicated, introduced by Environment and Land Use Committee, Kellen Nelson, David Larson, Randy Severson, Stacy Klein, Andrew Todd, Kevin Whalen, Anthony Munson.
Move to approve.
I'll second it.
Motion by Supervisor Nelson, seconded by Supervisor Todd. Any discussion? Yes.
Is Mark Carlson here to talk? Thank you. I would just like to, my concern is the letter we got from Forrest and Courtney Payne, who are very
Yeah,
concerned
we
about this.
received numerous letters, and we read
Okay.
them all into the meeting.
Okay,
And it was taken into consideration. We have a representative here that discussed it from his standpoint. And I guess the letters were read into the testimony.
okay. So were there a lot of people besides the Paynes that were concerned about this?
There was probably 10 letters that were all pretty much similar concerns.
Okay,
And I think, they did bring up some of the things that were going to be there, and that may alleviated some of the concerns. So he can elaborate a little bit more on it, any layout questions, but
that would be helpful.
it was
to-
passed. I mean, it went
Okay.
through the committee, and, the concerns were read into the testimony, and I think it was weighed, and then they did their presentation with some pretty good diligence on how things are going to be laid out, stressing that these were going to be monitored by the state, from an environmental standpoint. Stormwater runoff was going to be addressed. And the whole 28 acres by no means is going to be covered with buildings. It's just one big building and then another out structures with some fuel or fertilizer, liquid fertilizer storage. And that was all brought up at the
So
meeting.
were the people that are going to be impacted by this change, did they feel confident and happy
They didn't say
about
anything
this?
after the meeting. They did reach out to me on what the discussion
What?
was.
Okay.
Yeah, nobody was
Nobody
at the meeting.
showed up for the public
They were all
hearing?
letters.
Okay, just letters, okay.
And I did talk to a few afterwards via texting or emailing and said it was passed. And then I stressed to them that they should watch the meeting on the TV station. you know, because a lot of their concerns were brought up by the committee and the company. So, and I think they were addressed accordingly, so.
John?
I see we have a representative here from Provisional Partners.
John,
You
can
got
I
a question?
throw
Go ahead.
something- Yeah, I know, I don't have a question. I just got a comment on it. I think a lot of the major concerns when it comes to those 10 letters, and you can correct me if I'm wrong, the communication when it first came, where they first decided they want to do this, there was lack of communication because they didn't know which direction they were going to go. As it came forward, and as more time went through to buy this land, they actually put something together. And now I think a lot of the information is out there that's going to really happen. It's actually going to benefit the area more than it's going to hurt the area. So I think that's where the first concerns came out with your question that you asked.
I mean, I still don't feel totally comfortable, but I wish I had been there.
There was concerns that were
Because I
brought
know
up.
what it's like when you worry about where your heaven is on earth here in Trempealeau County, and then a big fertilizer company's gonna be in your backyard.
It's important to note that it's already
Right,
working
right.
right there. There'll be more environmental things implemented with this to control dust and runoff than what is there now. So we'll actually address
So you're
most
saying
of
it's
those
gonna be
issues.
better
Oh, yeah.
than it is right now?
100%.
Okay.
And I know the scrutinization that industry is held to, having worked at those, managing a location like that. There's nothing leaving there.
So you can make me feel better about
Yeah,
this
well, right
decision?
now, they
There's no
they unload
runoff.
outside.
Yep.
And this new plant, they're going to be unloading
Everything
inside.
inside.
So it won't
Dust
even be.
control.
And
out
monitored by you and the state and
By the state, not me.
by the
Yeah,
state?
not Mark.
Okay.
No.
We
And
do have a representative here
Right,
from
yeah.
Provisional
He's been
Partners.
here
Would you
waiting,
like,
so he
would
might
you have
Yeah,
a
come
comment
on.
you would like to make?
It might be helpful for me if you spoke to make me feel better about a decision I'm going to make.
My name is Joe Spiller. I'm the Executive Vice President with Allied. Also, I'm the Director of Agronomy, which is primarily what this facility is.
Right.
So I'd be happy to answer any questions you might have, I guess, that haven't been addressed or that you may still be wondering.
She
Well-
just wants to feel more comfortable about the facility.
Just the concerns that the people brought up that may, it's 28 acres, are you gonna just expand all over? Why do you need 28 acres? We've heard they wanna create a mega plant. So I'm just hoping that some of these things that they are worried about, they've lived this, right adjacent to them is the apple orchard that's been there forever,
Which we own that all now. We purchased 160 acres adjacent to this, of which 28 acres we're asking for a rezone.
Okay, so what are you gonna do with all the acreage that you purchased?
There's been no decision made at this time, ma'am, on that. My CEO addressed that at the zoning meeting. Once we have this zoning approval, I think it's possible down the road that property would probably look to be sold. We had to purchase the whole piece to get property to expand. It was sold as one unit, was for sale for a couple of years. We actually tried buying pieces off of it. They wanted to keep it together. That's how we ended up with 160 acres. It would not have been our desire to buy 160 acres, obviously. But we do have 160 acres adjacent to pretty much all sides there. The 28 acres was requested because of the topography of the land is very rolling and hilly. Also, there was an existing driveway with an existing structure that we kind of had to make a long skinny piece of property to encompass that driveway and that other existing building that was there to get on the 28 acres. We also have to have room for roads and stormwater retention areas, which will be part of the 28 acres. I think it's important to note that every single practice that we're planning to do at this facility, we are currently doing here today. The building and that facilities have been there for many, many years, long before even these adjacent property owners were there. And for some of the statements from some of the board members that were at in the zoning committee, the facility is more modern, certainly, and we are taking steps to make it more environmentally safe than even is what required. We are not required to load. We are not required to receive product under a covered structure, and we are not required to ship product under a covered structure. But that's how this new facility is going to be designed, with an enclosed receiving and sending or exporting of the product will be also loaded inside of a facility under a roof to protect us from rain and things like that. So the other facility is there today. It's the same exact products. This is bigger. We addressed traffic flow, truck patterns, things like that. It is our belief that we have a high volume of product now that comes in over approximately, I'll say 60 to 90 days, with predominantly a lot of that product coming in during 30 to 40 days. That'll now be brought in, stretched out throughout the season because the storage facility will be larger. It'll hold more of its annual use in the building versus today we turn that building about 8 times. So all that product gets turned 8 times during about 60 days. So it all has to come in during that 60 and go out during the 60. This new facility will be a larger facility for storage. In theory, it'll come in this time of year or in December or in January, spread out instead of having all that truck traffic coming in and going out during that really planting season, April and May, June for the 90-day period. So you're welcome.
Any other questions? Hearing none. We'll call for the vote. Go ahead.
Renee Lyon,
Yes.
Kellen Nelson,
Yes.
David Larson.
Yes.
Jeannie Nutter,
No.
Ron Johnson.
Yes.
Bridget Turner,
Yes.
Stacy Klein,
Yes.
Richard Seisha,
I'm an employee, I'll abstain.
Lori Severson. Andy Todd,
Yes.
Richard Anderson,
I'm like Doc, I need to abstain.
Kevin Adams,
Yes.
Dick Miller,
Yes.
Kevin Whalen,
Yes.
John Austin,
Yes.
Don Trug,
Yes.
Robert Becker.
Yes.
1, 2. It passes. 13.
It passes 13-1 with 2 abstains. Okay. We got the Healthcare Board of Trustees.
Whereas Chapter 20 of the Trempealeau County Code of Ordinances currently establishes the Healthcare Center Board of Trustees with 3 county board supervisors and 2 citizen members serving staggered 3-year terms. And whereas the Trempealeau County Board of Supervisors has determined that the governance structure of the healthcare center should be modified to expand the number of county board supervisors serving on the board while continuing citizen representation. And whereas the county board further finds it appropriate to establish uniform 2-year terms for all trustees beginning with the county board organizational meeting in May of 2026. Now therefore be it resolved that Trempealeau County Code of Ordinances statute, Wisconsin statute 20.01 is hereby amended to read as follows. Chapter 20, Healthcare Center, 20.01 Board of Trustees. Number 1, the Trempealeau County Healthcare Center Board of Trustees shall consist of 7 members made up of 5 county board supervisors and 2 citizen members. Number 2, each county board supervisor member shall serve a 2-year term with terms commencing in May of 2026 and thereafter following the organizational meeting of the county board held in the even-numbered years. Citizen members will serve 3-year terms. Number 3, terms shall be staggered as practicable as to provide continuity in governance. Number 4, the section supersedes any prior provisions relating to the composition and terms of the Healthcare Center Board of Trustees. Be it further resolved that all ordinances or resolutions in conflict with this amendment are hereby repealed to the extent of such conflict. Introduced by the Healthcare Center Board of Trustees, Stacy Klein, Bridget Turner, Bonnie Kinchy, Dick Miller, and Jennifer Solberg.
Okay. Motion?
Move to approve.
Motion by Supervisor Turner,
Second.
second by Supervisor Klein. Discussion?
Mr. Chairman,
Yes.
may I make a comment, please?
Yes, go ahead.
Let me get set up here. Oh, thank you. Okay. As you can see, there is a slight change in this board from 5 members to 7 and 5 board members and maintaining 2 citizen members. the Wisconsin code requires that we have a board of 5 to 9 members. Our corporation counsel in researching this determined that there is nothing in the code that requires that we have citizen members on that board. But we can have them according to home rule. So we are asking that we maintain the membership of 2 citizens on this committee. It is really important for the board to have a larger presence on the County Care Center Board of Trustees, as we are the governing body of the Trempealeau County programs and operations. And I think this is in doing so, I think we will perhaps strengthen our relationship with this particular part of our operation. So I would encourage the board to seriously consider moving ahead with this particular resolution. And thank you.
Any other comments?
Yeah, I don't see any reason for this. You already have, what, 3 board members on there and 2 citizen board. You already have control over most of the board and what it does. This is just putting 2 more people from this, like we don't have enough meetings to go to the way it is. I mean, it works the way it has. It's been working like this for 50 years. So why load up that board with 2 more members? I don't think they really need it.
I think it's a lot longer than 50 years, but.
Well, Mr. Chair,
Yes.
I'll just, I'll beg to differ with Adi.
You guys are sitting close, so be careful.
And the only reason I say this is because it seems to me if it was working, that the current board wouldn't have brought this forward. So I'm going to trust that those who are there are feeling as if making a change is necessary.
Well, we've heard from Dick, but we have 2 other board members here. Go ahead, Stacy.
Yeah, I would say, given the size and scope of the operation out there, I think it's very reasonable that we add a couple more board members, because you look at some of our other committees, even with the citizen members, we've got typically at least 5 board members that are involved. We should note, too, that there was another proposal that not only do we add 2 more county board members, but then increase the citizen members an additional 2. That could be a consideration. I know we discussed in our meeting that we appreciate having the citizen members and their background and knowledge. And then an additional point is having more county board supervisors that are familiar with the operations out there. I think that would greatly help the board in general.
Hey.
Mr. Chair?
Yeah.
Yeah, I think that in conversations that we've had, it was that looking at the budget, there was, a few months ago, there was concern amongst a few other county supervisors about, hey, what's going on out there? What's happening? What's this? What's that? So this also allows adding 2 county supervisors to that mix, also adds to that transparency of what the healthcare center is doing, what they're about, what their purpose is, and things like that. So that's where this all came about. And then we have had multiple discussions.
Discussion on one of each, like you said before. I think you said add 1 of us and add another citizen.
So ultimately, it's up to the County Board of Supervisors. So through our discussions, I think we all agreed that the board should be expanded. Again, like I said, the size and scope of it. But when it gets into specifically how we should expand that, we wanted to make sure it got passed, come up to the board. Right now, the recommendation is 2 more county board supervisors, but I guess I wanted to add that that was a discussion to add more citizens as well. So I think that's something we need to hash out here.
Stacy, is there anything in their rules of letter of incorporation that they have to maintain a 5 and 2, or is there anything in? Anything in your?
We need to maintain an odd
I don't know.
number.
I don't know.
Yeah.
I'm asking just.
Yeah, and it's through the state statute, like Dick brought up, that it's 5 to 7,
Go
9,
ahead.
or, I'm sorry, 5 to 9 members,
Here,
yeah.
Corporate counsel.
Just to echo what Supervisor Klein was stating, there is a provision within 4618, which is Wisconsin statutes, that says at its annual meeting, the county board shall appoint an uneven number of trustees. And this is really getting into it, but first it has to be uneven, from 3 to 9 at the option of the board for staggered 3-year terms. So there is something within state law regarding that.
So they could add 2 more citizen members too then. You'd
They
still have-
could. That's under home rule.
And then if, can
Is there
also,
anybody that opposed if somebody make a motion for an amendment to add 2 more citizen members to this?
that's.
Mr. Chair?
that's up to the
Yeah.
board, yeah.
I would object to that. We are the governing body of this county operation. And it seems to me that we need to maintain a significant number of board members on this committee. I think you look at the 2 committees that have citizen members, this is basically the same proportion that we're recommending of board members and citizen members. I think we all appreciate the membership of the citizen members on the committee. But when it comes to responsibility for making decisions and carrying them out, I think it behooves us to bear in mind that we as board members are the elected officials in this matter. So I think a 7 or a 5 to 2 ratio is very appropriate. Thank you.
Any other comments?
I'm just trying to think of the Human Services Board. I believe it's 4 and 3. We have 7. Because we have 3 community members.
I think there's 5 board members.
And there's 7 and 4. 7 board members on Human Services? No,
It's
oh, Health and
combined,
Human
yeah.
Services. Yeah, that's right, it got big, but
Just one more comment with this, because then we would go to terms that line up with the actual supervisor terms, which I think would be more clean going forward.
Okay.
I don't know how to phrase this, but is the healthcare center is aware of this and they're comfortable with adding more county board supervisors? They don't feel like, I think you know what I'm trying to say because you're looking right at me.
Yeah, we had the discussion last week at our board meeting, our committee meeting. So I guess any concerns or whatnot were brought up then, yeah. So
The Human Services Committee is or Health and Human Services, it's large, but we get things done and it's very comfortable, the ratio between, and having citizen, it's too bad you can't have an even number, but like one more citizen member. Citizen members bring a lot to the table, is what I'm saying, so.
Yeah, they do, and we're lucky enough to have 2 people who are citizen members that come from a medical background. So a lot of the discussions that are being had, they're familiar with, they're comfortable with, things like that, and they're active. They're active in the conversations,
Okay.
and their input is very well received, I think.
I think we've had enough
Okay.
discussion on this.
All right,
And
thank
everybody's
you.
had more than 3 cracks at it, so.
No, I didn't. I had 2.
You actually had 3.
I had 2.
So anyway,
Mr.
some of them had 5. So
Mr.
anyway,
Chair, I just got one, don't you think it'd be appropriate to have Jerry come up and tell us what his side is and if he thinks it's right or not?
I would.
It'd be
Go ahead.
appropriate or not?
I think it's a great idea.
Yeah.
Good afternoon, everyone. See if it's on. Is it on?
Yeah,
Red?
it's on. You're red.
This was presented quite some time ago. There's been a lot of discussion about it. I have some mixed feelings about it. There's been a lot of commentary, even from, some of our board members have brought forward that what's the healthcare center doing? Are there things, their transparency stuff? We've always been very transparent. We've been very honest. We've been forthcoming. The concern that I had and why when the change was presented to just additional board members, that was presented as just board members. I felt that was inappropriate as such because that's why I talked with Supervisor Klein, and also we had Susan involved with adding the community members, because they do earn and deserve the right to have input with a healthcare center organization, because we are so in the public eye and so forth, which individuals at this meeting have supported. Personally, I'm all up for change. I mean, in healthcare, there's things that we're changing every single day. 127 years, no one's discussed in this meeting the bylaws, because that would also need to be changed, because the bylaws do specifically address that. So that's something, whichever way this goes, that would also have to be changed, and I would be tasked for that. I feel it's been great the way it's been run. Does it bother me if there's more members? No. But again, my opinion was, if you're having more board members and less citizens, even though the Board of Supervisors are elected, it's still, their comments, their opinions, their votes still are very important, and they're validated. It's been running great. I know, Supervisor Miller is very passionate about this, and again, I respect his decision and so forth. There's been some good discussions about awareness for County Board of Supervisors. So I would, just leave that in your hands. Any other questions for me?
I have questions for you. Like you said, I think the current system's fine, because I know in systems when other county board members have come to you over the years, including in my terms, as from the general board that weren't on there, including difficult conversations and stuff, even when we might not have agreed, there was always respect that you showed to the main board, you and or the healthcare center has made. And even when we disagreed, there's always been respect between the two, so why change? So like I'm saying, why add more members? Because I've come to you and or the board, even some things I didn't necessarily agree with, and always had transparency and respect even when we disagreed. So I don't think we need to change it. And I can understand why you might be a little iffy on expanding it more.
And if there is a change, what I would ask is that there's, members that go onto this board that that have the passion we do. Again, I'll have 39 years, and 39 years in the spring in healthcare, and I know Mary's shaking her head. How did you do it? But the passion as a lifelong Trempealeau County person, and a passion for healing and recovering people and the healthcare center, and also not being on tax levy, I think, there has to be people on the board that care and have that passion. Thank you.
So,
John, can I ask a quick question?
Yes.
If this passes, when does it start? Does it start in April, or are we going to start now and put 2 more on there right away? Well, I see that for every May, or for every 2 years, I understand that, but
it would probably be made.
this would
at
actually
the-
start May 20.
It would probably
I
be.
see that, but I just want to make sure for this term.
I don't know when you normally meet. If it's after the county board meeting, if that's where they get elected to the April county board meetings, where they elect members to
So
the,
this says the term would start with the county board organizational meeting in May of 2026.
actually, the organizational meeting is April. So that should say April.
Would start in May after.
We
Well,
would be
look,
meeting
that
till
could
the
be.
first Wednesday in May.
Their first meeting.
They're,
They'd be appointed at the April.
okay, whatever. I don't know where they meet at county. I don't know when they meet now, so. Doesn't matter. Can we just,
We called the question, yeah.
Question?
okay, call the roll?
Andy Todd,
No,
Richard Anderson,
Yes.
Kevin Adams,
No.
Dick Miller,
Yes.
Kevin Whalen,
Yes.
John Austin,
No.
Don Trug,
Yes.
Robert Becker,
No.
Renee Lyon,
Yes.
Callan Nelson,
Yes.
David Larson.
No.
Jeannie Nutter,
No.
Ron Johnson,
Yes.
Bridget Turner,
Yes.
Stacy Klein,
Yes.
Richard Sasha,
No.
Lori Severson, 9-7.
9-7, is that a majority?
Yes.
Okay, it passes. I think that's all we're gonna do on that portion. If somebody like to, she's actually got sandwiches back here.
We gotta do the claims amendment.
You wanna do the claims? Audit committee.
Whereas the audit committee has audited the following claims and recommend that they be allowed as follows. John Austin, $1,742.80. Kevin Adams, 0. Richard Anderson, $694.90. Robert Beckert, $686.80. Ron Johnson, 0. Stacy Klein, $336.80. David Larson, $814.60. Renee Lyon, $452.80. Dick Miller, $394.80. Callan Nelson, $68.20. Jeannie Nutter, 0. Richard Sasha, $668.40. Lori Severson, 0. Andy Todd, $635.20. Bridget Turner, $624. Dawn Trug, $449. Kevin Whalen, $356. Total per diem, $6,000. Total expenses, $1,924.30. Grand total, $7,924.30. Now be it resolved that these claims be allowed as shown, introduced by Audit Committee John Austin, Richard Anderson, Kevin Adams.
Move to approve.
Motion by Supervisor Johnson.
Second.
Second, Dawn? Okay. Supervisor Troop, second.
Sign that. Call the roll.
Okay, call the roll.
Jeannie Nutter,
Yes.
Ron Johnson,
Yes.
Bridget Turner,
Yes.
Stacy Klein.
Yes.
Richard Sasha,
Yes.
Lori Severson, Andy Todd,
Yes.
Richard Anderson.
Yes.
Kevin Adams,
Yes.
Dick Miller,
Yes.
Kevin Whalen,
Yes.
John Austin,
Yes.
Don Trug.
Yes.
You got Kevin Adams here. He wasn't on the audit. Who was were you on the audit? You two?
Not me in this one.
Who was on the audit for this?
Were we on that one? Oh,
We got Kevin Adams on here. It should read.
Okay, all of Stacy.
You weren't there, but you did it.
Just put a line through his name and write it.
Okay.
Robert Becker, oh, he's
You-
gone. It should be Andy Todd.
Yeah. I didn't think he was there. Okay.
Robert Becker is missing. Renee Lyon,
Yes.
Callan Nelson.
Yes.
David Larson.
Yes.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 15. No.
Got distracted by John.
We had the wrong name on the audit committee, so. It should have been Andy Todd instead of Kevin Adams. Yes, we're gonna take a break now before we actually go into the budget. So,
Do you wanna, should we finish those last? Yeah, finish the proclamation and,
oh, yeah, you could do the proclamation, yeah.
yeah, let's get that done.
Go ahead, proclamation for Crash Responder Safety Week. Do you have that? I don't have it.
I have that.
Oh,
And
okay.
then what
Do you
about
want-
this? Do we need that too? Can we, I mean, I think
I
that'd
can
be
just
quick,
announce
right?
that.
Yeah.
We can just announce that.
Whereas Federal Highway Administration's Crash Responder Safety Week, November 17 through 21st, is set aside each year to recognize the often life-saving work of our crash responders and to protect those who protect you by following the slow down and move over law. And whereas every year, Trempealeau County's emergency responders work tirelessly to keep our roads safe, responding to 507 reported crashes last year, resulting in 5 fatalities and 118 injuries. And whereas at every crash scene, emergency responders representing fire, law enforcement, emergency medical personnel, county highway, towing, and transportation services are at risk of being struck and injured or even killed in a secondary crash. And whereas each driver has a responsibility to drive safely and take every precaution to reduce the risk of secondary crashes, which include following the state's move over law designed to provide a safety zone for workers on our roadways. And whereas 2021 Wisconsin Act 115 added additional protections for workers on Wisconsin's roads by creating a criminal penalty for traffic violations that lead to injuries in designated emergency zones. And now therefore be it known that I, John Austin, Chairman of the Trempealeau County Board of Supervisors, do hereby proclaim the week of November 17th through the 21st, 2025 as Crash Responder Safety Week throughout Trempealeau County, and ask all citizens to support this initiative to help keep those who respond to emergencies safe. Signed this 12th day of November 2025 in the County of Trempealeau. John Austin, County Board Chair.
Okay. That's just a proclamation. Announcements we have. We got committee reports, the Exec Finance Committee, budget and updates is in your packet. And correspondence, there was any, so at this time, we can take a break. Roll call.
Bridget Turner. Here. Stacy Klein. Here. Richard Zaisha.
Richard? Are you here?
We're doing roll.
Yes, I'm here.
Laurie Severson. Andy Todd.
Yes.
Richard Anderson.
Yes.
Kevin Adams.
Yes.
Dick Miller. Kevin Whalen.
Here. On the screen.
John Austin.
Here.
Don Trug.
Yep.
Robert Becker.
Yep.
Renee Lyon.
Here.
Kellen Nelson.
Here.
David Larson.
Here.
Jeannie Nutter. Ron Johnson. 15-2 at the moment.
Okay, we have the budget readings read.
Come back tomorrow.
So at this time, somebody would like to make a motion that we approve it at least for discussion.
I'd like to make a motion to amend. Can I do that first? Can I just do an amendment?
Gotta be the main motion first.
Just get the
Okay,
main-
then I motion to approve.
And then we go into that.
Okay.
Motion to approve the budget. Motion made and seconded to approve for discussion.
Yes.
Yes. Go ahead. You had some comments.
Yes, I would like to start, and I have some handouts for you so that we can hopefully move through this in a manner that we can get done yet today. So I want to thank everyone that took time to meet with me, to talk about things. So in a folder here, you're going to get some handouts. On the right-hand side is the newsletter for November. I just want to give you an update on that. We have Steve with us from Government Solutions. He's been really helpful in taking a look at where we're at and where we're going, and giving us guidance with our budget, as well as Amy Bergerson. Just can't thank her enough for all of her help. The budget that I have put before you, and I am required by state statute to provide you a budget. And
Extra, Amy?
and sorry. So my budget then works to hopefully be a partner with you in talking about long-term success, a goal for building fiscally responsible budgets for a strong future, and still consider how we stay within levy limits. We combat population loss, we maintain a strong workforce, and provide the best possible service to residents of Trempealeau County. So in the proposed budget, just to highlight again, it strengthens court and public safety services through key investments in jail, county attorney, and district attorney offices, addresses the auditor recommendations by creating a finance director position to improve fiscal oversight and efficiency, provides a 2% COLA and funding the wage study for mid-year implementation to move employees closer to market pay, maintains employee cost sharing in healthcare to encourage proactive health management. This budget achieves these goals without relying on new sales tax while maintaining strong reserves. Do you need to ask if there's public questions?
Is there public comment on the budget?
Anyone online or, no?
I don't see any public comment, so we'll just go into discussion of the budget.
Questions regarding the budget that we have directors here, if you wanted specifics on anything to pull out before we start talking about amendments.
Have you given the public the phone number to call in if they have questions?
No,
We don't do that?
No,
Oh, so when you want to speak, you got to be here in person.
Yep.
Or online.
Hold on. Dawn, you had amendment you
actually,
want to make?
I'd like to propose that we amend the 2026 budget to include the amendment number 1 as presented to you in your packet. Do I need to spell out the specifics of that?
Yeah, I would. I'm not sure what you're
All
talking
right,
about.
that amendment proposes that it says eliminate jail program coordinator, but what I'd like to point out is that there's an option to potentially combine the jail programming coordinator along with the reentry coordinator. I'd like to see us refinance the finance director to a lead accountant. Increase the COLA from 2% to 2.5%. No changes to reclassifications or the deductibles. In order to balance that budget, we would need to use $4,207.55 from the tax fund that we currently have an overage in.
Is there a second to her motion?
I'll second that.
Okay, we have a motion and a second. Any discussion?
Can you share a few things? I have
Yeah.
discussion.
Yeah, go ahead. Go ahead.
Although I seconded your motion, I believe there is a concern about the portion where you said reclassify and kind of merge the reentry program and the programming coordinator. That, to the best of my knowledge, cannot be done because the reentry position is all opioid funded. And so, to the best of my knowledge, we would not be able to do that. And maybe Susan can speak better to that.
So with that, the reentry position, that is correct. It is opioid funded. There could be a division of duties. That's possible. I know different staff have, they're funded through different pots of money. That would be a piece that if the board wanted to go with, we'd just have to make sure that we have a discussion further on the day-to-day basis. It's a very good point, and we can't mix those pots. It's possible to separate them.
Chair, I'd like to take a minute just to elaborate on the reasoning that I have behind that recommendation. I fully support the need for the jail to have a program coordinator and even a community reentry position. Where I'm struggling is that we have other needs within the county as well, competing needs, of course. And I think that we could make a modification to the programming, to the job duties, and bring in one person currently and see what that looks like over the course of the next year. Not to say that we wouldn't eventually need to go back to this as a potential option, but I don't want to start there. I think that it makes more sense to start with one position, identify job duties that can meet both of those potential needs, and then evaluate ongoing needs from there.
Can I just
Go ahead.
have Amy pass out a comparison sheet? Oh, it's in the folder. Just so you could pull that out on the back side, on the left-hand side.
What are we talking about? This one?
Yes, with the grid. So that lays all 5 amendments out. So we're talking about amendment number 1, and then you can see across all 5 then. Let's just talk about that jail programming director first and highlight that. I was just hoping that we could use the grid to kind of follow along and help us have a little, help the discussion a little bit, so.
Where's the programming director? Programming coordinator?
Yeah,
Okay.
right. So on the first proposal, it is made to just have the opioid position that's already been approved and coming forward and having the removal. I thought it would be helpful to have the sheriff talk and just kind of, if you're okay with that, and share
ahead.
his
Yeah.
thoughts on that.
So first of all, just so I'm clear, the proposal is to move the community reentry position forward
but not include the jail programming position? Is that what you said that's what the proposal you're talking about?
I think that's what's done.
That is the proposal, but with the idea that we modify the job duties of that position to potentially include some of the work that the community reentry, or that the programming coordinator might have been doing.
Okay, so where is the proposal that shows that we're eliminating the jail programming position? When did that come to light?
So that, I talked to Wayne and shared with him and talked to him that there are several amendments of individuals that had brought that forward in that possibility and how that would fit in the budget, so.
But those haven't been stated at the meeting today yet, correct?
That was just now in this amendment, yes. So I think that's where I was hoping that you could talk about the difference between the two
Yep,
positions.
absolutely.
And specify that.
So I'll start out with the community reentry position. That is a person that is going to have a social worker degree. It's a social worker position, and what it will do is it will assist those who are in basically drug crisis or drug addictions, and it'll assist us in managing the services that we can provide to both help them while they're in custody and once they're released from custody to overcome that addiction. It will assist them in by that person going out in the community and establishing relationships with employers to have that all done ahead of time so that we know who's going to take a chance on hiring individuals from our jail. That position will coordinate the medical pieces that are needed, the mental health appointments, the methadone clinic appointments, whatever they need to be supported once they're released from custody to fight their addiction. It will kind of work hand in hand with the community or with the jail programming director in that identifying what needs those people will have. Where can we, do they need more financial training? Do they need parenting training? Whatever we can provide to them to help them again once they're released from custody. But I think to get this program off the ground, it's going to be a full-time position, just being a community reentry. They're not going to have time to do anything over in the jail that I foresee the programming director doing. The jail programming director is not, it's to allow us to add to the options that we already have available for programming. And programming can be religious programming, it can be education to do with about anything you can think of. The list is very long on programs that we can provide to our inmates so that when they are released from custody, it substantially reduces their likelihood of recidivism. But this position also is going to be a certified jailer position. We have the capacity we will have the capacity to hold about 83, 84 inmates on a continual basis. And there are a lot of duties that come with adding inmates. Per the Department of Corrections Code 350, we are adequately staffed to do what we have to do over there. But it doesn't mean that we're not placing more and more burdens on our jail staff. The courts are placing more and more burden on our jail. And this programming director, being a certified jailer position, could help fill some of those. Can transport back and forth to court. They can do the fingerprinting during court. They will assist with the recovery court and the drug testing that goes along with the recovery court. This person will be filling shifts that are open during the day over there rather than hiring people on overtime. This position could have the potential to alleviate overtime as well, but it has to be a certified jailer position. We're not going to find a person who is a social worker and wants to become a certified jailer. So just for that reason alone, I don't think merging them is going to work. We are housing out-of-county inmates right now for starting January 1st, it'll be $50 a day. And my out-of-county housing next year, just for those contracts, is over $400,000. And that will help offset that programming director position. the opioid settlement money is already set aside to offset the community reentry position. So, from the start, we weren't talking about combining these two positions, and therefore no studies have been done on it. I can't answer questions today on it, other than I can say that was not the intent here, and they both have their specific certifications that are distinct from one another. So,
Mr. Chair? I'd like to ask
Go
a
ahead.
question of the sheriff, please.
Yes, go ahead.
Am I on?
Yes.
Okay, thank you. The question I have for the sheriff is, do you recall what your overtime budget total is for the jail? For filling the jailer slots?
It was budgeted at $55,000 for 2025, and we are currently at $228,000. A lot of that's because of the substantial number of open shifts that we've had throughout the year. So this position could potentially offset some of that overtime.
Well, I guess the question, I thought maybe it was bigger than that. I thought in the past, of course, you're spending a lot more than what you're budgeting. But I was thinking that if that position, due to what you indicate the importance of that position is, it could be funded out of overtime. But if you have only budgeted 50,000 for next year.
We did increase the budget a little bit for next year to account for the 2% COLA, but so whatever 2% of 55, but that's what our budget is for next year. The caveat with being so far over overtime is that we are, under in the wages and benefits as well. It's to be $173,000 over at this time of year, maybe we are a little bit underfunded in our overtime, but this position is proposed, it'd be a Monday through Friday position. It's not like it's going to be that person's going to be moving to nights and weekends to fill shifts, but we have a significant number of shifts that are open during the days, during the week too, so.
Thank you.
Excuse me. Any other questions? Go ahead.
Oh, I just have a comment. You brought up something right away when you started speaking about when was that position taken out of the budget. I just want to make a comment that we all got these different amendments. The public didn't get these amendments. And normally this is what we discuss at a budget meeting, is how we're going to amend the budget. And it's done in open session instead of meeting with the town administrator or whoever to make up these things. I don't care for any of these amendments. So I just want to know, how are we going to let people know what these all are? You didn't even know it was taken out of your budget. It kind of irritates me.
It's not out of the budget. And I did meet with the chief deputy because the sheriff wasn't working, and the chief deputy said that he would talk to the sheriff. So nothing's out of the budget. What I built into the budget, none of the amendments are out of the budget. So the amendments are before you, and I will share them on screen for individuals as well. I didn't want to interrupt the sheriff and take away the video from him. But the amendments are before you. The only one that's gone forward right now is amendment number 1, which Dawn spelled out. We're looking at all of them across the board so that we could have some type of organized discussion about this. So the very first thing on amendment number 1, if you were to take that forward, is removal of the jail programming coordinator. Sheriff is telling you why he wants to keep it. Now you will discuss. When we get done with discussion, then it'll be a thumbs up or a thumbs down, whether people feel like that should stay in or not. Then we'll go on to the next area of discussion, that all of these things were across the board, things that everybody brought forward in these amendments. So in the next piece, we'd be talking about the finance director. And that's in Dawn's amendment here, is saying that she would like to reduce the finance director, she talked about them, we'll have full discussion about that, and you can go back and forth and discuss so that the public is hearing that as well. We got back in after lunch and everybody wanted to get going, and so I planned on like explaining a little bit more before we jumped right in, so, but it's good.
Richard, you had a comment?
Yeah, I just want to speak in behalf of supporting the sheriff. That this position has been on the table for many, many years, back when I sat in Brett's chair. And I remember that the state jail inspector was pushing that at the time. And I know that it was brought up to committee members and I think county board at one time trying to get that position. But then we just kind of backed off because of, well, lack of money and other needs. But I do support the position. I think it's highly necessary. You know, it's a sense to help those that are in there as well. The sheriff did talk about saving some money in overtime in that. I got one quick question for you, Brett. When you put in your revenue to the administrator, has that changed since now that you've got Buffalo County?
So the revenue number in the budget is the proposed number, and that is.
Current.
Yep, that is
For
current.
next year, what you expect?
Yes,
Okay.
yep,
Yeah.
yep.
So anyway, that's all I have to say.
May I
So,
speak,
but-
Mr. Chair?
Go ahead.
Oh, I'm sorry.
Go ahead.
Sorry. I would concur with Supervisor Anderson. I think it's a very important position for us to consider. Society has changed and it keeps changing. There's a need for both of the positions. And so just to Supervisor Nutter, just to maybe help a little bit, I don't know if you had time to review this information that would have been disseminated to us on, I believe it was November 9th.
I did. I read it. I read it all, and my concern was just normally all of these are done in open session where we talk about we go through the budget, we talk about amendments. Maybe it's different now. I mean, we just have not, you know, had. I've read everything. I've talked about this. So yeah.
I sort of see it as an organized, expedited process. Because I went through it, and if you see it in black and white, to me, it's easier. It's easier to follow. You're discussing, things aren't written down. But anyway, just to make a point that I think it's easier to follow. And I think once we get used to this, I think we'll really like it. So I guess I'm not in favor of amendment number 1. So if you're looking at the options of amendments, and I don't want to upset your plan
Yeah, I
to
think
flow through this.
So you would just say you're not in favor of eliminating that position. I
Right.
think let's just stick on that position right now and have discussion like where people are on that position.
I would agree with
Okay.
Sheriff Anderson, former Sheriff Anderson, Supervisor
Once a
Anderson,
sheriff, always a sheriff.
retired sheriff. I agree. I think we've talked about this sort of position for years, and we were able to do something to help the jail when we got opioid dollars to have a position to deal with that issue. But for that reason and other reasons down the list here, I would not support this amendment because I do believe in keeping the programming coordinator. We don't do a lot for people that are leaving jail or in jail because we haven't had the space to do programming up there. So if we can start something, maybe we can make a difference.
Just for the record, that was your third.
Is there a certain amount of comments for me too, or
At
do I
least
just keep
just
to get
on
going?
that
So-
issue, right?
Yeah.
Okay.
The issue we're basically on is whether we leave this coordinator position in or out. That's basically the question.
So I'd like to have you think about it as, let's go through all the topics that are comparable, they are comparable across each amendment that if people want to bring forward. And then let's modify where we're at. We don't need to think about, we're gonna move into 2, 3, 4, 5, right? We're gonna modify what you want from each of these into this amendment and take in and out what you want or not. Or you can stay with the proposed budget. That'd be easy.
Right now, I'm looking for a motion.
No, we just like a thumbs up, or if there's more discussion on this, or otherwise we'll do a thumbs up if it stays or a thumbs down to remove.
Okay, you don't want to do a roll call?
Can I make a couple more comments?
It's up to you whether you want to do it. You can do both.
We can do both.
Yeah.
I think it
Okay.
should do a roll
The
call.
sheriff wants to speak.
Okay.
Yes, go ahead.
Yeah. So two comments. First, I did submit letters of support both this year and last year from Adam Trunzo, UW Extension, who currently does our programming, and from our jail inspector, our state jail inspector, also submitted a letter of proposal on how important the jail program position is. And one thing to consider is, we don't often think of inmates as anything other than inmates, but they are. And oftentimes, our family and our friends, and they live in our community, and I think we owe it to them that, they made a mistake at some time in their life, but this gives us a chance to help them be better and come back into society, so.
Okay, right now we're on, go ahead.
Yeah, just comment, because I'm in support of this position for all the reasons that the sheriff had mentioned. But then I do worry about the burden, like he mentioned, on our current jailers. We're kind of, to some degree, maxed out. And we just invested in adding all the new beds in there as well. So if we want to go forward with adding more inmates, we need to have adequate staff. And if this is going to help alleviate those issues, I think that's another reason to support this.
Okay. Go ahead, Don.
Yeah,
Oh,
we were,
go ahead, Don.
He recognized Don already, so you'll have to wait and speak after Don. Other change, you gotta change your name.
I can't, I'm sorry, Britt, but I just can't support this because of the fact that we shouldn't need more staff because we were told that would run the way it was with the staff it had. Number two, we've given all these inmates a very nice jail. They get all the amenities that you'd want. And I think it's set up really nice. So I don't think we are at the time right now to create something to help them. And we're struggling, trying to help our employees get insurance and get a pay raise. And I think our workers are a little bit more, not a lot, but a little bit more important than the inmates. And if we had the money, Brett, no problem, But it's the money's not there, and this year we're struggling a lot with, like I say, the insurance and the pay. So that's the main focus for me, anyway.
Don, you still have a comment?
Yeah, I do see the value of the position. I don't want to take away from that. And I think that these are all difficult discussions and conversations that have to be had. So the thing that that I think is important, or that I take into consideration, is we've not had this program coordinator before. Not that we don't need it, but we've not had it. We're going to be getting this opioid funded position. I understand that there are differences in credentials and the work, but I still think there's room to potentially modify that position to at least take on some of the work that you're proposing that the program coordinator do. And furthermore, I really worry that if we're looking at this being an offset to overtime, this person's going to end up working as a jailer. They're not going to be a program coordinator. They're going to be taking shifts to offset overtime. I would like to see where that takes us and reconsider next year.
Just a question. Now, we can use some opioid money for this position, can't we? Or it just doesn't work that way where you can use
No,
it?
not this.
The opioid money is for the community reentry position. And
Right.
it's because there's a nexus between the drugs and the opioids, and that's what that money was for.
Right.
This isn't, really doesn't have anything to do with the
Doesn't
drug part,
directly
so,
go
yeah, we
towards
wouldn't be able to
that.
tie
Okay.
that to
Okay,
that.
thank
so,
you.
yeah.
Your comments are over. You're still going. Okay.
John?
Any
can I
other,
say-
yes,
yeah.
go ahead.
I'm going to make it personal for everybody. Of course, everybody knows where my store's at. I personally had an employee working for me, and I worked for almost a year. Got back into drugs, just checked the DA, and there he is in jail. Now he's back out. It'd sure be nice to have somebody right now helping that individual, because he's even going to church with us. And they might need that little extra push to try to help them out, because honestly, I'm telling you, he's a year, and it was a really good employee. So it's just something to where if you're going to make it personal, if it's your family, you'd want somebody there to help them. That's where I'm at.
Can I make a comment too?
Mr. Chair,
Yes, go ahead, Dick.
the budget amendment comparison grid, I don't have the whole thing on screen here. And so I can't see the bottom row or two. Is there any way to be able to pick that up?
There.
Okay. So the difference in cost appears to be the addition. If we were to add that second position to the sheriff's department, it would add 81,000 as opposed to the 4,000, which is suggested that it be taken out of the potential sales tax revenue.
No.
I guess I would suggest
That
that
isn't,
we
that
vote.
isn't it, Dick. It's
So-
actually the 77,000.
Yeah, so the cost of that position is 77,119. Right now, it's in the budget, so you leave it in there, it's just a zero change. Where you start looking down is when we start to talk further about other things that we might
sure.
change. If we change the COLA and things like that, that will add to the cost. But right now, if you eliminate the programming coordinator, you're gonna save 77,119, and then Steve's gonna put it up on his chart, and he's got a calculator that's gonna put it through in our budget. If you keep it, we're just at zero, and we keep talking then on the next thing.
Okay, well, I guess I'm not sure if it's proper procedure to do the thumbs up vote.
No, we're
Rebecca, and I'm
we're
wondering-
gonna take.
We're gonna do a roll call
We're
vote.
gonna do a roll call on it.
I can't see your thumb anyway, so.
Yeah, okay, thank you.
Before I got cut off, I'm going to say this as respectfully as I can. I think I support, we need this program coordinator. I know some older people don't like change, and not saying all people, but as a younger person, as somebody that's the Generation Z, whatever the ones behind it, I think there are some changes that are good. I think I understand as a younger person, number one, we need some changes, move forward. Number two, people do make mistakes. And it kind of rubs me wrong when certain people say, oh, our employers are struggling, which they are, but to put inmates down that they're subhuman makes me mad. Also, even though I don't have I used to work in the mental health field. That's why I'm in the Health and Human Services Board. I also struggle with some mild mental illness, which they can go together and combine. People that have crimes and have mental illness, we struggle too. Whether you have mental illness, and I'm getting a little worked up, or a criminal background, we're human. Thank you. That's why part of the reason why I'm the secretary of the Health and Human Services Board, because I have real life experiences. Thank you.
Okay. Are we ready to call the vote? The vote is to eliminate, or was it to approve? Okay, it's number one. It's to eliminate,
Just to eliminate the. yep.
to eliminate the programming
polls.
coordinator.
Yeah.
Programming coordinator.
So you say yes,
If you say yes, you want to eliminate them. No, you want them hired. So it's already in the budget, so this would be the savings of the 77,000. She's already got it in the budget to have a programming coordinator, so. Ready to call the roll?
Kellen Nelson,
No.
David Larson,
No.
Jean Nutter,
No, and that's to keep it, right? I just need to be
You
clear.
have to keep a programming
no.
coordinator.
Ron
Do not
John,
eliminate the position.
No.
Bridget Turner,
No.
Stacy Klein,
No.
Richard Seisha,
no.
Andy Todd,
No.
Richard Anderson,
No.
Kevin Adams, Dick Miller,
No,
Kevin Whalen,
He had to leave.
Oh, he left
sorry,
temporarily.
John Austin,
No.
Dawn True,
Yes.
Robert Becker,
Yes.
Renee Lyon.
No.
Okay, it stays in, so it's,
Okay, so we're at zero change, except I should say, we're not at zero change because we did make the addition of the wage change, right? That was about 19,455. So we will have to, Steve's gonna put that in his calculator. He's already got that in there, 19,455 that were up. So,
That's our
that's
per
for the
diem.
per diems, sorry, the per diems. That you, yep, per diems for the individuals here, yes.
well, that's for the county board.
Yes, for the county board. 19,455.
Susan, can I make
Okay,
So.
are we going right down that
Yep,
line?
yep.
Finance director?
Reclassify the finance director to a lead accountant, save 20,000, then add that 20,000 to corp counsel line. Now, I just want to remind you, corp counsel is currently, we set aside, or I have in the budget set aside $60,000. This would add to that to 80,000 to help, so that she has help. When I set up the budget, I did not include any of the excess sales tax funds that we've brought in this year. I'm conservative, and I was, we've always gone right up to the $2.8 million, and I felt like that was a good thing, just to have some cushion in there. But after a lot of conversation and hearing more about the COLA and things too, I did talk to Steve, who's a finance director, right, and said, what are your thoughts on that? Am I being too restrictive on that? And Steve, if you wanted to comment as well, Steve basically said, we have a very strong fund balance. So it feels like that would not be a problem to add that in. Steve, do you want to just comment?
Sure. Can everybody hear me?
Yes.
Okay. Yeah, I concur with what Rebecca just told you. So being conservative is, I guess, better if you're worried about, collecting that revenue. If you had a shortfall of, say, 50,000 or 100,000, the county still is in great financial shape. You have roughly 48% in your unassigned fund balance. So that wouldn't be a huge risk to the county if you decided to, go all in and budget to the max on that. I think you'd be in good shape either way.
Okay, thanks. And so that is in consideration and how we're making this work. And so Forward Analytics from WCA has estimated that we will be up about 300,000 next year. So that's a good estimate. We don't know that for sure always ever, but that is a good estimate. So in talking about the reclassification of the finance director, I put in your folders this paper clipped item right here. There was a conversation about, do we have to, that we're fine, that, and I'll just, this is what I took that out of, a Baker Tilly. It's from the reporting and insights from 2024 audit. I just like to share a little bit. Our evaluation of the internal controls over financial reporting has identified control deficiencies that are considered material weakness surrounding the preparation of financial statements and footnotes, including the schedule of expenditures of federal and state awards, adjusting journal entries identified by the auditors, and an independent review of financial reports. Then it goes on and it says, management has not prepared financial statements that are in conformity with generally accepted accounting principles or the schedule of expenditures of federal and state awards that is the conformance with the applicable federal or state requirements. In addition, material misstatements in the general ledger were identified during the financial audit. Then it goes on to say, these are all the numerous decentralized locations where money is collected. And that's of concern, where there's not a centralized person that's overseeing the collections and what's happening. So example, procedures and controls to help mitigate that risk, and usually this is a finance director that puts those things into place. So I just bring this forward to you in thinking about, I know that Supervisor Severson had a document that she wanted shared. I believe it's on her desk if you want to pass that out. Basically, it just shows how many, you want to pass it around, yeah. How many counties within the state have a finance director, and it's 54 have, I believe, 50 some, and the rest don't. So I share that with you, and I want to work in partnership with you to make sure that the county is as safe as we can be and doing the best we can with the finances we have, the taxpayer money we have. I did follow up and I gave you that job description from Jackson County. They do use that position. I shared that with Steve and he reviewed it and he felt like, yes, that's a good step. So if I'm in agreement with saying, if you want to make a step towards a finance director, I think that's a valid conversation. Again, essentially, I'm saying eventually, I would recommend that you have a finance director. And Steve, you're a finance director. If you could step in, I think one area too that I've talked a lot with Steve about is the ability of this person is going to be able to give input, their value to save the county money.
Yeah, so I'd love to talk about the finance director position. In our report, I believe we recommended to you that we felt that the county would be better served by having a professional on staff. Currently, you're fulfilling that role by having us work with your staff at the county. Seems kind of counterintuitive to my business plan, but my business plan is to go out of business because my whole intention was after I retired is to give back to my profession and not do this long term. I do want to retire at some point. And I think, in my opinion, you certainly would reap benefits. And in my opinion, finance directors pay for themselves. Every meeting, you have legislation coming before you, resolutions that probably should have a fiscal impact statement on them that tells you what is there a cost to that legislation. This person would be doing those types of things to assist the board in making good business decisions. And again, I'm recommending this knowing that when you hire somebody, we're losing revenue, but that's my plan, so I'm okay with that. It's in your best interest to do that. Now, with that being said, you're also in charge. It's your budget, so you can do as you see fit and, take the input and use it as you'd like, and you get to cast your vote and do as you choose.
Okay. Lori, I see you're online. You want to make a comment? I see her.
Are you talking to me, John?
Lori.
Oh, Lori's there. Yeah.
We can't hear you, Lori, if you're talking.
Here, can't hear you, Lori. Are you on mute or something? Oh, I'll go on here. What?
Someone need to make a motion on this?
Motion to include the finance director or reclass? Is it to reclass it to an
So
audit?
I think so because wasn't Dawn made the
Original
the
deal.
original motion to, and that includes that, the reclassification of the finance director.
To making a finance lead down to a lead accountant, which would save 20,000 off the budget. So,
Are those combined that if we vote to reclass to lead accountant, that 20,000 goes to
goes back
per
in.
council? Or is that a separate thing we have to vote on?
Probably separate.
Okay, so we're just voting on one thing?
Yeah.
Okay.
Okay. So it's, the vote is, if you're in favor of dropping a
Mr.
financial
Chair, can I-
director, making a lead accountant, you'll save $20,000.
I have a question.
Go ahead.
Looking through the entire package here, there is a point of eliminating the finance director. How does that fit into this vote?
So that should be a part of the discussion right now then, is saying, okay, so there is someone who's interested in eliminating the position altogether. So my first part was saying to you that if you take the reclassification to a lead accountant, that saves 20,000. another person who's saying, well, we could eliminate the position altogether. That would take 140,000 out of the budget entirely. And so that is your point to discuss whether, what you think should happen here.
So I'm very confused. If we vote, and you made me confused, thank you. So if we vote to reclassify the finance director to lead accountant, and then we go to another amendment which has eliminated altogether, so then we don't have a lead accountant or anything.
Right, so we're not going to another amendment.
Okay.
So have the discussion
I'm
right
sorry.
now. So you're saying, okay, someone says, I think that the reclassifying is the best route. And then someone says, I think we should eliminate it. And you have a debate on what you think would be appropriate.
So we debate that later when we get to a different amendment.
No,
Right now.
no.
Right now. Or you leave it as is.
So
I have
whoever
it
thought
built
this
into
was
the
gonna be
budget.
easy,
Or
it's
you
not.
leave it as is, as I have it built into the budget as the finance director.
Right now, she has it in the budget as a finance.
Okay.
Correct.
If you want to save the
Okay.
$20,000, you change that to an
Mr.
account.
Chair,
Yeah.
given the fact that this was already built into the budget and some of the research that I've done, I've also been very lucky in the village that we hired a finance director for the village who actually manages a much smaller budget than what the county has, and he has done wonders with the finances. He has helped to create, he is full-time, he has helped to create a TID district, he is helping us with the development, he knows the avenues, he more than pays for his wages in the opportunities that the village has now. Plus, we know that our books are correct. Payroll is correct. All the monies that we have to pay to the federal government are correct. And so I am in huge support, given that this is already written into the budget, that we keep it. Thank you.
Any other comments? Go ahead.
Mr. Chair, can you hear me?
Yes.
Yes.
Yep, we can hear you,
We
Laura.
can hear you, Lori. Go ahead.
Oh, wonderful. Great. My only concern is just to make very sure that, like Bridget mentioned, that we are in compliance with everything. And I'm a little bit concerned that we actually are. We have to make sure that what we're telling the community is 100% correct, and that we don't have anything that we just missed or is a oops or whatever, so that we have a big responsibility to make sure that those things are covered, correct? And that's my big thing, is just making sure, do we actually know that we are 100% correct?
Yeah, the auditors.
Well, the audit should say that
Well-
whether you're correct or not.
Is there a motion on the floor?
Yes, we have a motion on the floor. Basically, it started with Dawn, and we're all of these are coming off Amendment 1. And we're just on the finance director part of Amendment 1. And right now on the floor is the question of whether you want to not have the finance director, just have a lead accountant, which would save $20,000 on the budget, which is already in there. So this would save $20,000. So the vote,
I guess
the
the
vote now
question
would
I
be.
have,
Go ahead.
okay, the question I have, if the person who made the amendment and second would, with your permission, Mr. Chair, would take back their amendment, and I would make an amendment to approve the number 2 plan as listed here.
This is very.
Well, wait a minute. We're on one, that's a different,
I think,
You're-
so we're working through each piece because each one has the same components. So
Well, but
we're gonna get to the rest, yeah. We're gonna go through that whole line and talk about each thing that's in each of these categories.
so right
Okay,
now
so
we're
there's
just-
an amendment, there's an amendment to reclassify the finance director to lead accountant. That's what's on the
table
on
right
the,
now.
Correct.
table. That's what's being discussed. Okay.
May I make a
Okay.
statement, Mr. Chair?
So, yes, go ahead.
Just to clarify, and maybe that's what you were going to do now, sorry for interrupting.
Yeah.
But to clarify, the way it stands, the financial director is in the budget.
Right.
This motion is to determine whether or not that position that's in the budget be reclassified to lead accountant for a savings of 20,000. Thank you.
Right. That's it.
Mr. Chair, I would say that if we were going to be able to save ourselves $100,000, that might be important. Again, we're talking about a difference of .020 in the entire budget. And I think we're selling ourselves short if we don't maintain that.
But we can eliminate finance director account completely. That's still available.
Yes.
And I just like, what do you pay Steve? Do we know that number?
$20,000 a year.
I'm in favor of sticking with,
So Steve, if you wanna,
I'm in favor of sticking with Steve and eliminating,
Steve's
and you
not gonna be
folks can
around
work
a
your
whole
way
long
through it.
time because Steve is retiring.
So,
But go ahead, Steve.
so, yeah, if I could just maybe address that. The money that you pay us is really just a Band-Aid to get you through. There's no comparison. I mean, I'm living in Green Bay. I'm not over in Whitehall. You need boots on the ground, somebody there, sitting there, working with your departments each day to truly get the full impact. And I would state that your auditors have told you by saying there are material misstatements in your financial statements. That tells me that if you ran financial statements off your system right now, which I know this is a true statement, they are not accurate. So if you ask the clerk to run financials for you, they are not accurate because not everything's recorded correctly. Some things aren't recorded probably. So to make decisions using the information you have available is inaccurate, and having a finance director there is just going to pay you dividends. I can't stress it enough, but again, it's your choice. This is my opinion. So it's up to you.
Okay.
Mr. Chair, may I?
That's
One other
100%
comment.
what I
Go
was
ahead.
trying to say,
We
Mr. Chair.
had,
Lori's on.
okay.
Let Lori go first. Go ahead, Lori.
Yep. Thank you. Mr. Chair, that's 100% what I was trying to say is, are we 100% sure that things are correct today if we run the financial numbers? Do we really know that those numbers are correct? And I'm hearing that that's not correct. And that's what I was concerned about with reading the audit.
Okay.
Well, your audit is correct because your auditors have gone through and made the adjustments. But prior to your audit, which doesn't occur until probably July or August of the following year, you truly don't know where you sit financially.
Correct.
I mean, that.
Correct. But Steve, you're still saying if we ran it today, it probably wouldn't be correct.
That is an accurate statement. Yes.
That's my concern.
Yes.
Mr. Chair, if I could
Okay.
just give an
Less
opinion.
Less
I'm
than
sorry.
2 years ago, we hired an administrator thinking that that was going to take care of some of these issues. And it's just too quick for me to start adding people to that department. That's why I'm saying thank you.
Okay.
May I comment?
We have one more coming up.
I'm sorry, sure, sorry.
Steve, you might be able to answer this question. When we met out at the healthcare center about the enterprise and so forth, with this board, I'm still unclear. I'm overseeing the healthcare center organization. In one board meeting, Rebecca, I've heard from you that this finance director does not affect the healthcare center. But then at the recent most board meeting, you stated, yes, it does. I will see over your finances too. I specifically asked you, do you understand Medicare, Medicaid, all the operations? You stated that's why we need a finance director. We have a full-time finance director. Now, our finance director and myself oversee about 30 million of that budget. So to include the healthcare center in that, you have had the opportunity to come to the board meetings, review the budget, and also participate. So I'm still unclear because it's come up at least 5 times that I'm getting it both ways here. Yes, we have a finance director, it's not going to affect that role. But then the next comment I hear from you, yes, I want the oversight. I don't understand where you're coming from.
May I speak to
Go ahead.
this? In the conversations that I've had and looking, I don't think there's a concern or a question about what the finances are at the healthcare center. What has come up and what is most important is that whatever finance director, if this county decides to hire a finance director, that they oversee the entire county, which by extension of an arm is the healthcare center. Yes, a finance director would know what they need to know, and they're not getting into the business of managing your finance at the healthcare center necessarily unless they see something else that could be, and maybe not be any portion of the county, and also making the county, whether it be supervisors, administrator, whatever, aware of the finances out there. It's another oversight. It's another, it doesn't change the need, I don't think, for you to have a finance director.
Well,
And I'm not, is that your question?
That, it has been presented both ways, okay? Because even Rebecca, you have informed me that you want the oversight of the healthcare center for financials. Now, we are, I don't like the term arm under there, we are under the umbrella of the healthcare center, but we still have a finance director. This person shouldn't be needing to report because she reports to me, and we have a budget that comes to our board of trustees. We take no tax levy. Putting another layer of management, which at our last board of trustee meeting, you guys all got a sheet of, I think, 13 organizations that oversee us. So to put another layer on there doesn't seem appropriate.
To me, it seems that if there's a finance director and they're responsible for what is going on financially throughout the entire county, you are part of that county.
Am I
this
saying that
county.
we're not part of the county?
No, but what I'm saying is that if they're responsible for looking at finances and things like that, that is part of it. I will also say that I don't think that any of this
Let's call the
necessarily
question.
is a discussion
Is relevant.
for this budget.
I don't think this is relevant.
It's
Okay.
a side
Could I-
discussion.
We're getting out of hand here.
Yeah.
Go
Steve,
ahead.
can I ask Steve to just interject on that? Because maybe I've misspoken, or I think maybe if you could clearly state that
Sure.
whole piece. I'm thinking more on the collaborative piece, but go ahead.
Yep, no, I would say that if you passed the budget with the finance director and you created that position, day to day, Jerry, you wouldn't see any changes at all. I mean, to your operation, because you're right. You have yourself and you have Lori, I think it is, right, as your CFO. And, you know, you guys do a great job. There's nothing to be taken away from that. This position would be here for higher level stuff because you are part of the county. So for instance, if you were going to say borrow some funds and you needed the county to help, this person would work with you to assist to get that to come before the board or any things of that nature. But day to day, I don't think anything really occurs except if maybe the finance director saw a way to collaborate, they might propose or float a balloon to you and say, hey, what about this? Or vice versa. You guys may have an idea that you want to bounce off the finance person for the county. So day to day, I don't think your operation is impacted at all.
Okay, I think it's time to call a question myself.
John, can I say one
Go ahead,
thing real
one,
quick,
go ahead.
please? Where I'm at with this is we don't have to spend more money. I mean, to me, I think we can eliminate this financial director. Maybe look at putting more towards principal on our loans. I mean, it's okay not to spend money that we don't have. I mean, I'm just saying it's okay to go towards the principle of trying to get our debt down a little bit more and quicker. We probably should look at that.
May I comment, Mr. Chair?
One more time, that's it.
Okay. I
on,
understand,
you got
Supervisor
two more
Todd, what you're saying, that's good financial sense, but I think we're at the point where the county has come a long way in the past 2 years. We have a new program, we have a financial program. We need to, provide the correct staff to bring the Trempealeau County as far as we can go. We've got the tools, let's do it. We need professional people to take care of this great program. I think we need to do everything we can to excel, and this is part of it. Thank you.
By the way, you got a comment? Go ahead.
I just want to say, I agree with Andy. I think this ain't the time. This came so late in the year. Had we started this in January, February, March, and we would have gotten more information and set it up more, and we would have been able to make a better judgment on this. This is a huge amount of money just to say at the last 3 months of the year, go, oh, I think we need this. I don't agree with that. I just, there's no way I can vote for this.
So basically what the amendment on the floor was to reclassify the finance director to a lead accountant, which would save $20,000. Now, if you want to make a different motion to completely eliminate both, that's a separate amendment.
I think I would vote on this and see where it ends up, and if it is voted down.
Go ahead,
then
Rich.
bring that.
So we vote on this here to make that transition. I'm kind of confused, just like Supervisor Nutter right now.
Thank you. I'm still
If that
confused.
happens, does that mean that we're going with an accountant?
Well, not necessarily.
you-
It could
if-
change. We could change that yet. It could be, it could, yes.
There's four more amendments.
There's 4 more amendments. You can eliminate the whole damn position eventually.
And these are the amendments that Rebecca brought to us, but there could be more on the floor that's brought up.
Across here.
My concern is that, and I spoke about this before, about
Bring
the
that up.
copay for the employees of Trempealeau County. And I've gotten more calls on that, on the $500 and $1,000 that we're looking at taking away from them. And to me, it's a short notice. It's, when in September they were notified about it. So if.
Now we're
this-
getting off the subject.
Well, you know what? No, I don't think so, John.
Well, I think we're going to be
Off of
addressing
this.
that as
We're
we
gonna
go.
be here forever
We're
if
going
we're-
through each topic
I know, but
individually,
my
yeah.
point is
yeah.
that if we don't address that as well, there won't be money for that.
Oh, I see what you're saying, yeah.
So you have that
Yeah.
built into this amendment already, the reclassification, so it does, and you did have the funding to make that work.
Okay.
You could amend this to eliminate the position completely if you wanted to, because it's in it.
Go through the reclassification piece on this. and-
Go through the reclass?
Yeah.
That's eliminating what we can vote on, though.
Well, then you can come back and.
Okay. At this point, we're gonna vote on the reclass from finance director to lead accountant, which would cut $20,000 out of the existing budget. So, call the roll.
Lori Severson.
What happened?
Oh, we lost her.
She's gone again.
Andy Todd.
No.
Richard Anderson.
No.
Kevin Adams.
No.
Dick Miller.
Are you sure you know what you're
This is
voting
a
on?
vote,
I don't think you know what you're
the
voting.
no,
The
You're
vote-
voting on
This is to
keeping,
reclass the
not taking the
finance director.
$20,000 out to reclass it to an accountant.
Yeah, I don't want none of that to happen.
Well, you can change it later.
Now we gotta make after all this, we gotta make a motion to get rid of it. That's what I wanna do at the end.
Yeah, I
do too.
I don't see that myself. To me, what the question on the floor should be is, do we want a financial director or not?
Correct.
Or-
Correct.
Or an accountant.
Or accountant, or whatever.
I agree.
But
I
do
agree.
you want to get rid of the financial director and the accountant?
Yes.
yes.
Okay, then make a motion to that effect.
Motion.
Mr. Chair, we've already started voting.
Then we'll see where everybody's at.
Yeah, sorry, I know that this is a long day and it's getting busy. We already have a vote started on this. And so we need to finish it and then come back and answer those questions.
Well, the way they're voting for a
If it-
financial
if it-
director.
If it
They can,
fails,
they can change their vote if they want, but then we need to immediately go back to the next or the underlying issue. Because we already have a first, a second, and votes called.
So I can vote, say, we're gonna change it from a financial director to a lead accountant, and then I'm gonna vote later to get rid of the lead accountant and vote for none. Is that correct?
That is what you can do. I think it's a strange, I understand, we're kind of getting a little bit circular.
Okay.
But we have a first, a second, and a call of the vote, so we just have to finish our action.
Okay, so I'm gonna change my vote to yes, to change it to a lead accountant at this time.
Okay. Richard, you're next.
Yeah, I misunderstood it too. I'll say yes.
That's what
Saying
I
yes?
thought.
Kevin Adams? Okay. Dick Miller?
Yes.
John Austin?
Yes.
Don Trug?
Yes.
Robert Becker?
Yes.
Renee Lyon?
No.
Kellen Nelson?
No.
David Larson?
No.
Jeannie Nutter?
Yes.
Ron Johnson?
Yes.
Bridget Turner?
No.
Stacy Klein?
No.
Richard Sasha?
Yes.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 to 5.
And a 5.
okay, so
It
now
passed.
someone can make a motion.
Mr. Chair,
Now we can make a motion to what?
Motion to whatever, to either.
What is the outcome of the vote, please?
10 to
10 to
5.
5.
to change,
It passed.
Yes, 10 to 5?
10 to
You're
5 to
10
change it to an accountant. Now, there's someone that would like to bring forward the possible elimination. So is there a motion on the floor to
Eliminate both.
eliminate?
Mr. Chair,
Yeah.
I make a motion that we eliminate the accountant position.
And I will second that motion.
Motion by Supervisor Larson, seconded by Supervisor Todd to eliminate both positions is basically what it amounts to, so. Any more discussion? Okay. I'm hearing no. So it's to eliminate the finance director and the accountant. So,
No vote.
yeah. And the both. They're both basically on one motion, because we already did
So
eliminate. the
say
finance.
yes if you're saying to eliminate, no if keep as the accountant.
Right. So,
This motion
if you
is
want
to eliminate
if
the
you
lead
want to
accountant.
eliminate the accountant,
Say yes.
yes. If you
If
want
you want
to,
to keep the accountant position, no.
no.
But the finance director is not part of it.
That's already gone.
Correct.
That's already gone.
Okay. All right.
John Austin?
Yes.
Don Trug?
I'm sorry.
To keep the accountant, to keep the accountant.
I want to
no.
keep the accountant. I don't know which way I have to
This
vote
is
for
to
that.
Eliminate.
No.
Then you vote no.
That's right, because the motion is. to
No.
eliminate.
Yes.
No. Oh.
Robert Becker?
Yes.
Renee Lyon?
No.
Did you say no?
Oh,
No.
yeah.
Okay, thank you. Kellen Nelson?
No.
David Larson?
Yes.
Jeannie Nutter?
Yes.
Ron Johnson?
Yes.
Bridget Turner?
No.
Stacy Klein?
No.
Richard Sasha?
Yes.
Lori Severson?
She's gone. She's not up there
Andy
anymore.
Todd?
Yes.
Richard Anderson?
Yes.
Kevin Adams? Dick Miller?
No.
Kevin Whalen is gone, sorry.
Where'd he go?
So both, so that position is eliminated, so now you have 140,000 saved in the budget.
The vote was 9 to 6 in favor of eliminating the
Yeah.
lead accountant.
What was the vote, please?
9 to 6.
Thank you.
So now we're down to the wages. Cola? Yeah.
Can we, don't you think it'd be better to get down to the deductible thing before we go to the wages? Because what, you should really approve what the insurance is gonna be, so you know what way you should go. If you get rid of, if you keep the deductible, the raise is gonna be less. If you get rid of it, it should be more. So we should clear that up, I think, before we do the COLA.
So you're trying to move out of Amendment 1 to something else?
No, just, I think if you wanna talk about it, just go down to deductible subsidy.
Oh,
you know, and figure out that one first before we go to
Yeah.
two wages.
So what's on the table is to keep the budget as is with the deductible that the employees pick up the deductible. There's a motion or a conversation about whether that should be reinstated to 250 and 500 coverage. So that is what right now it is, the employee is picking up the deductible.
Can I make an amendment?
Can I make a motion?
Oh,
You
God.
don't need to. So we're just gonna vote on whether the deductible remains eliminated. In Amendment 1, it remains eliminated.
This is all under Don's original motion for
Right.
Amendment 1.
So if you want to change that, you're gonna vote no, that it's not eliminated, and then you can have discussion about at what level you'd want that
Okay, yeah.
reinstated.
The way the motion is on the original deal was to eliminate the, what do you call
The
it?
deductible
The
subsidy.
deductible supplement.
I would, Chair, if it'd be nice, I'd like to make a motion on the table to keep the deductible as is right now when it comes to where we're sitting now. So 500 and 1,000.
Are you making an amendment?
Or make it.
Because
Well,
I
that's
tried to
basic-
do that and they told me no.
I'm not sure how to do it.
That's basically in this thing already. It's either remains
Not
or
250.
eliminated.
I don't want
Remains
250 and
eliminated,
500.
it remains
So just-
eliminated, or if
just
you
vote
say
on
no change, it
first.
stays.
Just vote on first if it stays eliminated, and then you can come back with a motion to say the 250 or 500, whatever, so. Yeah,
So
let's,
a yes vote is to eliminate it and no vote is to keep it. Or
The subsidy.
the
we
way
can
you would
read
read it? Is that the way you would read it?
Wait a second.
She
No,
said
this,
that
this,
backwards.
this verbiage is
Yes is eliminated.
What's
It's got more confusing to me.
I think you're going, I think you're going to have to explain that because I
Yeah.
think people are,
I want to make sure I got this right.
so,
In the budget.
if, it's already in the budget, so.
Eliminated. It's eliminated.
It is already.
Yeah, so we.
Right, it is already eliminated from the budget. So if you vote yes to remains eliminated, if you vote no, you're saying you want some other conversation on how to bring that back.
Okay, so no is to bring it back.
Yes.
Okay. Does everybody understand that? We'll call the roll.
It's in the budget to eliminate. The question is
It's not in the budget, period, because it's eliminated.
to be eliminated.
Yeah.
So the question that you'll be answering is, do you want it to remain eliminated?
Yes.
That's correct.
Yeah, okay.
Richard Anderson,
No.
Kevin Adams,
No.
Dick Miller,
I'm still unsure. I've heard too much from this end. What, again, tell me what's what here. No represents what?
It's- There's no,
the 26 budget is set to have no subsidy for deductible. The vote is, do you want to keep it that way, or do you want to keep
Oh,
it
I see.
eliminated?
So a yes is to keep it, a yes is to keep it,
Correct.
a no is to put it back in, okay.
no, a no is, a
yeah.
no is,
No, he's got it, he's got it.
No, he's got it.
oh, okay. Yeah. Yeah, that's right.
Dick Miller,
Yes,
Kevin Whalen is gone, sorry. John Austin,
No.
Don Trug,
Yes.
Robert Becker.
no.
Renee Lyon,
yes,
Kellen Nelson,
Yes.
David Larson.
No.
Jeannie Netter,
No.
Ron Johnson,
No.
Bridget Turner,
Yes.
Stacy Klein.
No.
Richard Sasha.
No.
Lori Severson,
She's gone.
gone again. Andy Todd.
No.
Okay, so there has
What
been,
is the vote?
5 to 10.
to add it, to
Five.
add something back. So to reinstate at a 250 to 500, that's $89,000 that you need to fit into the budget. And if you keep it at 500 and 1,000, that's 178,000 that you need to fit into the budget. You've already eliminated 140, but you've added 19,455. Steve, where are we at?
Yeah, we are currently at 120,455 under your target.
Okay. So if you reinstated to 200 and 500 as the deductibles, that's 89,000, you're already to the plus 120,000, so you would subtract the 89,000 from 120,000, so then you're still up. If you go to the 178, you're going to be to the minus about $58,000. Again, you have sales tax funds.
And
Okay, and if
I
we-
just want to make this clear, and Becky, tell me if I'm wrong. You reinstated 178,000, but that's only if everybody uses all of their deductible, correct?
Well,
Right. Right. But I just want to, it's informational, that's all.
but
It's all-
Amy, we use it, right?
Right?
I'd
Yeah,
like
we
to
use
make a
it.
You're at
motion.
No,
We have a motion already.
What is it?
It's a motion, well, you can
no,
make.
we don't have the.
We don't
We
have
got
a motion.
to the.
We have no motion.
250, 500, or 500,
No.
1,000, basically.
No, we
No,
We're looking for
we
a
don't
motion.
have that.
No,
I'm
we're looking for a
looking-
motion for one or the other.
I'm looking for a motion to reinstate it to what it was prior to the budget, 500 for single, 1,000 for family.
Okay, motion by Supervisor Nutty.
I'll
Nutter.
second that.
And motion is seconded by Supervisor Anderson. Any questions on that? So now it's to reinstate it back to original, put it back in the budget, which would cost like 178,000?
178, yep.
178,000. So,
And that,
call the roll. Oh,
that doesn't give us the percentage yet. That's not gonna guarantee the percentage yet.
no, that's a separate
It's
deal.
gonna be the COLA.
No, this
No,
is just,
this-
We're
this
not
is
at the
just,
COLA yet.
this is just,
Yeah, the deductible, I'm sorry.
The
Yeah.
deductible.
I said COLA.
yeah. This is the deductible.
Oh,
Not saying it's not gonna come out next year, but this year it'll still be in for this coming year.
I'm going to.
So anyway. Ready for the roll call.
So yes is to reinstate
Reinstate,
full.
That's
Oh.
my motion.
the
Yes.
motion is to reinstate the full benefit package we had before, the 500 and 1,000. Okay,
Jeannie Nutter.
Yes.
Ron Johnson.
Yes.
Bridget Turner.
No.
Stacy Klein.
No.
Richard Seisha.
Yes.
Andy Todd.
Yes.
Richard Anderson.
Yes.
Kevin Adams.
Yes.
Dick Miller.
Yes.
John Austin.
yes.
Don Trug.
No.
Robert Becker.
Yes.
Renee Lyon.
No.
Kellen Nelson.
No.
David Larson.
No.
2, 4, 6, 8, 2, 4, 6.
So it passes.
Yep.
To reinstate full. Now, Steve, where are we at? 'Cause
9 to 6.
Because that puts us
So-
up, Steve. Where are we at?
Yeah, 57,455.
Okay, we're up 57,000.
Over the budget.
Yep.
Okay.
Now you want to go wages.
Where is that? Oh, that's,
Right.
wages.
I would like to make a motion on the floor to eliminate the wage study for 2026.
Okay, let's go to, do you want to do that first or the COLA?
Well, we could actually do the wage study first and then we know where we're at. Motion on the floor is to eliminate the wage,
Okay,
a second to the wage study motion.
I'll second it for discussion.
Okay, motion made. Any further discussion on the wage study? Motion on the floor is to
Yes,
eliminate the
yes.
Wage
wage
study
study.
was in the budget, correct?
yes, yes,
Yep.
so you would be eliminating the wage study and you would be saving 60,000.
Okay, Mr. Chair,
Yes.
I think this wage study, the purpose of the wage study is to determine whether we need to be at 2 or 2.5 or 3. And so I think we need to, that needs to remain available so that we better know how to move forward. And I think in that wage study, if I'm not mistaken, correct me if I'm wrong, there would be opportunity to adjust in some cases during the year. Is that fair to say?
I'll let the,
It is if those are kept in there. Yes, there is funding in the budget to implement.
One
Yes.
thing about the wage
Okay,
study,
then
it doesn't
then I
include
would be-
county
I would
auto, and it
be-
doesn't include the highway.
Correct.
Okay.
I'd definitely be in favor of maintaining that wage study. And then when we come back and vote on the wage, I would think should remain at the way it's stated in the budget at 2%. Thank you.
Okay, you guys ready for the vote? The motion was to eliminate the wage study. So,
Say yes if we want to limit.
yes. Okay,
John Austin,
yes.
Don Trug,
No.
Robert Becker,
Yes.
Renee Lyon,
No.
Kellen Nelson,
No.
David Larson,
No.
Jeannie Nutter, Ron Johnson,
No.
Bridget Turner,
No.
Stacy Klein,
No.
Richard Sasha,
Yes.
Andy Todd,
Yes.
Richard Anderson,
Yes.
Kevin Adams,
Yes.
Dick Miller,
No.
3, 4, 5, 6, 7, 8, 9, 6 to 9. So that failed.
That failed.
Mary, can you just announce that louder so that they can hear online?
That, to eliminate the wage study failed from a vote of 6 yes and 9 no.
So the wage study stays. This is my recommendation. Because we have others who have said eliminate the market increase in July, and re-eliminate, and so I would say, if you're going to do that, then you should not do the wage study. It doesn't pay to do the wage study and let it sit there. So, you've already done the wage study. I would not recommend getting rid of those increases, the potential increases in July. Don't do the wage study then.
Can you do it and use it for next year's budget? So we,
You're
this
gonna be a
way,
year behind already. That just take the 60,000 and put it into next year to do the wage study, because, you know what I'm saying? Because you're
Yeah.
a year behind already. Just don't even bother. So,
I'd like to make a motion to leave the COLA at 2% with anticipation of the wage study in July.
Well, the wage study is gone already.
nope.
No,
the
we
wage
voted to
study's
keep
there.
it.
Oh, you wanted to keep it? Okay.
Get
So-
Jen some more caffeine.
So you want 2%?
I want to leave it at 2% with anticipation of the wage study coming.
I've never been a fan of percentage, period. I like hourly.
Second.
The biggest problem with percentage is it just keeps the spread getting bigger and bigger and bigger, and the top gets a good raise, and you're down the bottom of the totem pole, you ain't getting nothing. So,
It actually causes more problems with compression, and so you're going to cause a lot of problems with the wage scale and individuals that you get compressed, so that individuals on the bottom get closer to the top, and that's the issue that comes in with hourly wages, so.
we have it out at the
It
highway,
is
and they
not,
just
and
love it.
and the finance director is shaking his head in agreement. I'm just telling you, this is the recommendation. That is not wise, but you have control of this budget, so, it's not, and the purpose is to make sure that you're compensating individuals, appropriately. And again, we've had a lot of reclassifications where we've found that we are low.
So Chair, what's in the recommended budget?
The,
2%, I think.
the
now.
2% is already in, yeah.
That's already, okay.
Yep. COLA, yep.
Go ahead. We're,
Steve, I think we're up 50-some thousand, right?
Oh, I'm sorry, I was muted there. Yeah, 57,455.
2% will put us over how much?
Nope, 2% would keep us.
it's in there.
It's in the budget. If you go above that, then you're gonna add to that.
So right now, we're 54,000, whatever you said, 455 over what's in the budget?
Yes.
Okay.
Mr. Chair, are we moving on from the reclassifications
That
and
was my
whatnot? I
question.
mean, I'd like to finish one area before we back
Right.
into the COLA, is my opinion.
You'd like to finish the what?
The reclassification.
talking
Right.
about
Oh.
if they want to do these limiting
57 and then the
reclassifications and
60.
the.
Like, I don't want to leave those hanging and then
Oh,
come
I-
back.
okay.
That's what I'm trying to get to, and you won't.
I don't, they're all
Mr.
a
Chair,
different.
based on
Right, but anyway.
Becca's recommendation about not eliminating the July adjustments.
I can't hear you really.
Sorry, usually somebody accuses me of talking too loud.
You're talking very softly right now.
I think you got a cold.
But I would want to make a motion to eliminate the reclassifications pending the wage study.
We already have a motion on the floor. We have a motion on the floor.
Where was it? I didn't hear it.
Yeah, we have a
So much-
motion a second, but then
The
is that
motion in
something
the
that we
second was
should?
for 2%.
The motion is second. What's the motion we have on the floor? I'm not even sure.
That was to keep.
Okay, the motion on the floor is to leave the 2% as in the budget. Is that agreeable with everybody? Leave it in budget, so we'll call the roll on that. To leave the 2% COLA. Yes.
Mr. Chair, I can't with good conscience make an educated decision on this, not knowing what other pieces we're gonna compensate employees with. Voting on the 2% right now before deciding the other pieces was like wiping before you poop.
Because we could
Okay.
rescind.
I'll rescind my motion.
Okay, the
Okay.
motion's been rescinded. Okay, now what motion do you want?
I love that metaphor. I'm gonna use it.
Tell it. What's your?
Right now, the reclassifications are in there, okay? For $57,000 and doing a market rate, once the wage study comes in, actually implementing. Those two things are already accounted for in the budget. Is that something that is an issue?
So if you eliminate them, you're saving the 117,000.
It's already in the budget.
It's already in the budget.
I know,
already
but
in
if
there.
you eliminate them, so what's your motion?
I'd move to leave it as it is presented in the
second.
budget.
Okay, so.
For
that's
discussion.
Basically, what you're under is, under reclass is under number 5, basically, right? Is that what you're doing?
Yeah, I mean, we voted to keep the wage study, not,
Right.
so. Basically, my motion would be to maintain it as is, no change.
Okay.
That's essentially, because we already voted to do the wage study, my motion would be to keep the reclasses in and keep the budget there for mid-year post. Yes, that's my motion.
Explain, can you just explain the mid-year for people who might not understand that?
As I understand, the mid-year adjustment would be pending results from our wage study. If we find out that this position should be 30 cents higher, this one should be a nickel, whatever, things like that, we've got dollars assigned sitting there for those, for
Okay.
that implementation.
So people, thank you, that was.
And I'll second that
clarifying.
motion.
Yeah, I already did.
Oh, I'm sorry.
It's okay.
Let's call the question.
Increases.
Let's just, okay.
Are they in here?
Vote on
Yeah.
that first.
All right.
Let's just vote on that first. They're keeping.
Okay, the vote is to keep the reclass in the budget with mid-year implementation.
Okay.
I agree.
Renee
Vote
Lyon.
Vote yes if you want to keep those two pieces in the budget. Vote no if you want those removed.
Did you
Okay.
call my name?
Yes, Renee Lyon.
Yes.
Kellen Nelson.
Yes.
David Larson.
No.
Jeannie Nutter.
Yes.
Ron Johnson. Bridget Turner.
Yes.
Stacy Klein.
Yes.
Richard Sasha.
Yes.
Andy Todd.
No.
Richard Anderson.
Yes.
Kevin Adams. No?
No?
Okay.
Did you say yes or no?
He said no. He said no.
Oh, I
Okay,
didn't- I
sorry, didn't hear
understand
him. Dick Miller.
Yes.
John Austin.
that. No.
Dawn Trug.
Yes.
Robert Becker. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
10 to 5.
10 to 5. 10 to 5.
Okay, so those things stay
keep-
as is.
Yep.
All right, now to the COLA. Right now, in the budget is a 2% COLA. You are up 57,455. You have about 300,000 total, so you have about, what, Steve? 200 and, what is that?
Yeah, here, I put it up on the
43,000.
screen there. Yeah.
243,000.
Well,
There's
So-
about 243,000 remaining.
okay, I'm not clear on that. What was the last
I don't
motion
either.
that got voted?
So
Because
they
I have
just,
57.
oh, they kept the wage study and the reclassifications and the market increase after the wage study mid-year. So that's nothing changed.
Right.
So we're still at 57,455, if I'm correct.
That is correct. Yep,
Okay.
we're under, or I'm sorry, over budget by
Over.
that amount.
Right, we're over. And if they were looking at the sales tax as a fund, they would have about $243,000 yet. Is that correct?
And the
Yep,
2%.
yep.
Yeah, okay. So 2%'s already included. If you want to do more than that, it would cost you 81,000 to go to 2.5. You have about 250, 240. If you go to a 3%, it costs you 162,000. If you,
163, basically.
there's a suggestion to go from a 2%, keep the 2% and add the 30 cents across the board. That's 280,000 additional, which puts you over. So you would not have a balanced budget. You'd have to cut something else. And the 80 cents an hour increase, Steve, that's eliminating the COLA. So that is within budget, correct?
I don't have that right in front of me, I'm sorry. Let me look here. So 80 cents, so you're talking to all the options. So currently in the budget is 2%, right?
Yes, yes.
Yeah, so, I mean, if somebody wanted to make a motion, if they want to change that, then we can react to that and tell them what that's gonna be.
Okay.
Because it would be an increase, unless everybody's happy with where they're at with that and the wage study to help fill in the gaps.
Yep, may I comment?
Go ahead. Was that what you were gonna do?
No, now we can discuss, right? So that's
Yeah.
perfect. Okay. That, I was getting ahead of myself. I guess I'll just say that originally I was looking to want to increase the COLA from 2 to 2.5. I thought that was an important thing to do for our employees. But if we are now going to be subsidizing the deductible, I no longer am in favor of that. Because I guess I feel like that was a way of meeting them halfway.
I agree, Don.
I agree with that too.
I would make a motion.
We have a
that we
motion.
accept the budget as amended.
Are you amending? There's already a new emotion.
No, there's no motion on the floor.
Yes, there is.
Yeah, there is. The motion on the floor is to go from 2 to 2.5%.
Oh, someone did put that in. I didn't even hear
Yep, so that's
that.
being debated right now.
Okay, I think what Dawn just mentioned makes good sense. I think we need to move ahead and approve the whole budget. We're ready to go.
Go ahead, Richard.
Does that go to the extent of the levy then, or where would we be at? Can you ask him to let us know where we'd be at?
We're
Yeah,
still-
where
we're still
would
at-
we be at with the 2.5%, Steve?
With the 2.5,
Yes.
Well, add 81,000
Yeah.
to the 55, basically.
how much I don't have that sheet in
Oh,
front of me.
okay, so
Rebecca.
it's
What's the-
81,326.55, then added, that would be over budget.
Okay.
To the 55.
We'd be over by,
Mr. Chair.
we'd be over 138,781.55 if that were to pass.
You use that sales tax?
But the sales tax is out there. Mhm.
Okay, look, yeah,
I
we
thought
don't
you
get
just-
that much sales tax.
So
I thought I just heard that the motion is for the 2%. Am I correct?
2.5%.
Oh, good
The-
grief.
Mr. Chair.
I have bad connection here.
I guess you do.
So with the wage study and the reclassifications and going up to a 2.5%, we would then put us over the budget that Rebecca has already presented to us.
No.
No.
No, because the wage study, the reclasses, and the market rate increase half year is already in the budget. So that's not an increase because it's already there.
Even when July comes and we reclassify
Yes.
and add.
Yeah.
It's already
we're
in
still
the
Money
budget.
set aside, yep, for that.
Thank you.
Okay, go ahead.
My only comment is, it's been really a tough year for everybody, and the last 8 months have been really tough with SNAP benefits, blah, 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 blah. Everybody knows that because we work here. So anything that we can do to support employees, we do a lot to support the infrastructure of this organization, new roads, new buildings, new furniture, et cetera, et cetera, et cetera. We need to do something for the human capital that's in this building that makes this system run. If we don't have people and if we don't support the people, we don't have doors to open in the morning.
Good point. Okay, I want to make sure I understand. You do want the motion is to go from 2 to 2.5. So it adds $81,326.55 to the budget.
So if you vote yes, you want to increase to the 2.5%. If you vote no, you want to stay at the 2%.
I would like to ask though, Mr. Chair, that if we go to 2% versus 2.5, where does that end up at the end? The difference? You said 100 and some thousand would have to come
No.
out.
130 some thousand
And then
dollars.
how about if it's 2%?
If it's 2%, then it's 57,000 we're up.
57,
Yeah,
okay.
57,
Okay.
yeah.
Yep.
55 basically, right?
We're ready.
55. Okay. Okay, everybody understand what we're voting on?
Yes
This
to
is going
increase to
from-
2.5%, no to stay at the 2%.
We don't have to
Okay.
vote again.
The vote is to go from 2 to 2.5%.
If you vote yes, you're voting to increase it to 0.5%. So,
Ron Johnson.
Yes.
Bridget Turner.
No.
Stacy Klein.
Yes.
Richard Seisha.
No.
Lori Severson. Andy Todd.
No.
Richard Anderson.
Yes.
Kevin Adams. Oh. Okay. Dick Miller.
No.
Kevin Whalen. So sorry. John Austin.
yes.
Don Trug. Robert Becker.
Yes.
Renee Lyon.
No.
Kellen Nelson.
Yes.
David Larson.
No.
Jeannie Nutter.
Yes.
2, 3,
Tied.
2, 3, 4, 5, 6, 7.
Well, unless we can get Kevin in here to break the tie.
Motion fails. Motion fails, it tied.
Yeah.
Motion fails, so it stays at the 2%. All right, now where are we at?
I think that's it, unless,
Is there anything else on the budget?
Yes, I got a question.
Yes, go ahead.
Okay, where do we stand on getting the DA some help, if that's in the budget?
yes,
And corporate counsel gets,
that's
Right now,
is
I'd like to make that motion.
okay,
60,000,
and that's, okay, that's already in there.
that is.
But we still have to make a motion to approve it. No, that'll
it's in
just
there.
go with the end of the
Oh, you
whole
have to
budget,
approve what?
right?
Yeah.
Okay, that's good.
To
I
make a
think it's-
motion to approve the budget as amended today.
I'll second.
Can I just interject something?
Yes.
You need to balance your budget. You're at 57,455. That you're
So
over budget.
do we need to
so
make a
you-
motion then to take that money from sales tax?
If that's your choice, yeah, that would be reasonable to do that. Yes.
I make
I-
a motion to take
I'll
that.
add it to mine.
I think we still have some budgetary discussion here going on before we.
Is there more?
Possible?
Yes, you have more.
Mr. Chair,
Oh, God.
I would like to make a motion to add $20,000 to Corp Council's budget. I know she is sorely overworked and needs the help. So
I'll second that.
Got one on the floor already. Do you want to rescind it?
Yeah,
If
you want,
you would,
I'll
I would ask you
rescind
to
my
increase
motion.
that 50 so that then she can hire the full-time person.
I'd make that motion. Make the motion to 50,000. For
Miller
to hire-
seconds it.
Mueller seconded it.
Miller seconded that motion. We
I
said-
rescinded mine and whoever
Okay, that's
seconded
rescinded,
it.
the other?
Seconded.
You got to rescind too.
So
What's
that's
that?
rescinded the first motion. So this motion on the floor is to increase
50,000 to Corp
50,000 in
Council.
Corp Council.
And I'll second. I think I already seconded.
And do we want to add
Bridget
taking the
did.
money out right away, or do we do that separate?
That's separate.
Taking the money out of,
Out of sales.
Out of
tax.
sales tax.
When we do the final budget,
okay.
We'll balance it.
300.
you can say to take it out of sales tax.
Well, that's what we are this year and that's what's
Oh, okay.
projected.
Okay.
So
Um,
Rebecca, can I ask a question?
Yeah, please.
So if the intention is to add 50,000 to the Corp Council's budget, I presume that's to add a position, correct?
Yes. That's correct.
So I would think the motion should include that the position gets added too. Otherwise, we're just adding 50,000 to the budget.
That was a part of my motion.
Okay, part of the motion is to include an assistant district, or
Okay.
corporate counsel.
I apologize, I didn't hear that.
Okay. So
Okay. Vote on that one
we're
first.
voting for $50,000 to add a position to corporate counsel.
Might I clarify that that's on top of what's already in the budget for,
Yes.
which is 60-some thousand right now?
Yeah, 60.
Enough then?
So we're gonna add another 50 on top of that, correct? Okay.
John, can I ask Susan if she could or just clarify why that is necessary, just so everybody out there understands it, why we're voting for this and so on, if you don't mind?
No, that's I think a fair point. And then if I may, I am not a benefits person, and I would respectfully ask maybe Amy or if Shelley is watching to run the benefits, because right now there is 60,000 for professional services, and then cumulatively that would be 110, which I certainly appreciate. I'm just not sure how much the benefits would be. So I want to put that out there. The wage would be obviously a chunk of that, but there's that aspect. So I am the only attorney for all of the civil matters in the county. When I submitted a request to for another position, it was lengthy. It was roughly about 6 pages long, close to single space. Trying to break that down, there are several pieces to it. The workload, first and foremost, is there for two. I have, through child support alone, over 1,300 cases. My workload also includes not only just the cases, but every single ideally contract would be read. Ideally, every single policy would be located and then read and updated. We would start dealing with some of the ordinance amendments. So just working through this is quite lengthy. So I have the court piece to it, which is always going to by statute have to come first because I have to be in court. I don't want to make any of our judges unhappy, and we only have one, but I'm in front of a lot of judges throughout the day. That also creates a liability risk. If I am stretched between all of these different things, I can only give so much time to any one thing. That also means that I don't have, and I'm not saying it's easy for anybody, but I don't have what you would typically have for vacation or sick days to have those. I don't, to me, it's a luxury. I don't have that most employees would have. And I'm not saying that employees misuse it at all. There's no backup. And if I have a jurisdictional requirement to have a hearing within 72 hours, I'm showing up unless I'm really, 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 I cannot move. I think the nature of where we are at, unfortunately, we are more litigious than we used to be. And we are seeing more and more issues. One hand, I'd like to be able to be proactive and look at those, which I addressed kind of with the looking at our contracts and looking at our policies, but the other hand is really
Okay,
doing more of a
okay, thank you.
defense as well. And I'm happy to answer any other questions, but just in the interest of time, knowing it's long, I'm trying to summarize it.
Right, nope, I appreciate that. Just, again, just for out there, for the size of our county, I guess you've checked into that to where, how many attorneys are for certain counties? I mean, I'm just trying to get it out to the
Just for the record,
people.
before she was here, we did have two.
That's correct, yes.
did
I
have
did
two
know
corporate
that, but I
counsels.
just want to get it out there. There's other people listening, so.
So,
We did, and it varies. There are one or two out there. I haven't quite figured out why they might have one. I can tell you Clark County is similar. A lot of times we talk about Clark County being almost akin. They have two. La Crosse has at least 4. I think Eau Claire has 5. Buffalo has historically had a whole firm, so you can kind of go back and forth. I think Jackson County has the same. I think Becky at some point did a more holistic approach and looked at that. And I know it's been looked at through other departments as well. Just offhand, that's what I can remember.
okay. Okay, the vote is for a 50,000 increase. I don't know if that's gonna be enough, but we could always address it later if it turns out to be not enough. But at this point, the vote is to increase corporate counsel's budget, $50,000, so she can hire an assistant corporate counsel. So, call the roll.
Andy Todd.
Yes.
Richard Anderson.
Yes.
Kevin Adams, sorry. Dick Miller.
Yes.
John Austin.
Yes.
Don Trug.
Yes.
Robert Becker.
Yes.
Renee Lyon.
Yes.
Kellen Nelson.
Yes.
David Larson.
Yes.
Jeannie Nutter.
Yes.
Ron Johnson.
Yes.
Bridget Turner.
Yes.
Stacy Klein.
Yes.
Richard Seish.
Yes.
Good deal.
Unanimous, thank you.
That's the first one we agreed on.
Sure is.
I'd like to make a motion to approve the budget as amended
You got
with
something else?
the,
First have a
wait, I'm gonna say how we're gonna balance it. We're going to use the overage from the sales tax
To balance.
to balance.
Okay,
seconded
just to let you know then, it's 107,455. I put the worksheet up there, so you increase your sales tax projection by 107,455 to cover the difference.
107,455?
And the money comes from the sales tax, you said?
Yeah. Okay.
Who was the second on
The
that?
second was Mr. Becker. He was so quick.
Okay.
I
Now
barely
this-
got my mouth shut and he seconded it.
This is to approve the budget
Yes.
as amended.
As amended and where the money's coming from.
Okay. And we have a second from Mr. Becker.
Yep.
Call the roll.
This is the one we've been waiting for. Dick Miller.
Yes.
John Austin.
Yes.
Don Trug.
Yes.
Robert Becker.
You betcha.
Renee Lyon.
Yes.
Kellen Nelson.
Yes.
David Larson.
Yes.
Jeannie Nutter.
Yes.
Ron Johnson. Bridget Turner.
Yes.
Stacy Klein.
Yes.
Richard Seish.
Yes.
Andy Todd.
Yes.
Richard Anderson.
Yes.
Kevin Adams.
Yes.
Thank you. 15-0.
Pass. No, we're not done yet.
He's got to leave.
We're at. You can't be here for the close? You have to leave? Okay. So I'm gonna make a motion that we go into closed section.
So moved.
I just want to thank everybody for the hard work.
Yeah.
And, I'm sorry, who made the motion, Kellen? We need a roll call vote on this.
Who made the motion to go into closed session?
Miller did.
Oh, Dick Miller.
Oh, yeah, Dick Miller made a motion to go into closed session. Okay. Call the roll to do it.
Richard Seish. Okay.
Okay.
Want to go into closed session?
You just gotta go. You ain't gonna be around. Yeah.
Session.
Well, you wanna vote for the closed section before you leave, Richard?
Hey.
Richard, you wanna vote for going into closed session even though you're leaving?
Oh,
Okay.
Andy Todd.
Yes.
Richard Anderson.
Yes.
Kevin Adams. Dick Miller.
Yes.
John Austin.
Yes.
Don Trug.
Don, yell.
Robert Becker.
Yes.
Renee Lyon.
Yes.
Kellen Nelson.
Yes.
David Larson.
Yes.
Jeannie Nutter.
Yes.
Ron Johnson.
Yes.
Bridget Turner. Bridget Turner.
Yes.
Stacy Klein.
Yes.
15-0.
Okay.
Okay.
We're in closed session. Okay. Somebody want to make a motion to,
I'll make the motion to affirm the decision made in closed session.
I'll second.
motion by Supervisor Larson, second by Supervisor Nutter, to affirm the actions taken in closed session.
And just for clarification purposes, can we state generally what that was?
You can.
And so the vote is on motion to affirm the county board's decision to disallow the claims.
Claim, okay.
Okay,
Correct.
I'd call the roll if you got one there.
Everybody left.
You have the roll, right?
Oh, I am so sorry. Not used to doing this. Stacy Klein,
Yes.
Richard Sasha,
He's got,
Lori Severson is, I believe, gone.
oh, gone.
Andy Todd,
Yes.
Richard Anderson.
Yes.
Kevin Adams.
Yes.
Dick Miller.
Yes.
The next one is Kevin Whalen, who is not here. John Austin.
Here, I mean, yeah,
Don Truitt.
Are you?
Don Truitt.
Yes.
Robert Becker.
Yes.
Ren-
John needs to smoke.
Renee Lyon.
Yes.
Kellen Nelson.
Yes.
David Larson.
Yes.
Jeannie Nutter.
Yes.
Ron Johnson.
Yes.
Bridget Turner.
Yes.
And that's all in favor of those who are present, and we have 3 that are not present.
okay. That's all I see on the agenda. So, we can adjourn at 4 o'clock.
Awesome.